If I ask you, see, what is the most common cause of suspended animation, where you can see it most frequently? Most commonly, it is seen in newborn baby, right? Newborn baby, right? And newborn, this is most common. See, what is the legal aspect of suspended animation? That being a doctor, being a clinician, you have to be very, very much careful, okay, before declaring a person as dead, right? So suspended animation, okay, so like here, you can resuscitate the person back to normal life, right? Dr. Diksha, yes, we have to resuscitate them. Yes, we have to resuscitate them. What is happening here? See, please understand that, okay, body will be alive. Okay, body will be alive because there will be dissolved oxygen in the body tissues and fluids, right now, like in the body fluids, right? Fine. So even, see, even the electric injury, like even, see, like this can be produced voluntarily also by yoga practitioners, right? So all these things are very, very much important. Next, see here, to perform Brislow's second life test, stomach is taken out and incision is given over greater curvature of a stomach during autopsy. Which method will be followed here for the for the autopsy of a stomach? See, what is the meaning of autopsy? Autopsy means what? Yeah, autopsy means the post-mortem examination, right? Now, post-mortem examination. So whenever we have to do the post-mortem examination of heart, and whenever we have to do the post-mortem examination of heart. Dr. Shubham, see, first question, answer will be suspended animation. Okay. Okay, fine. So whenever we have to perform post-mortem examination over heart, okay, now, so we have to, see here, we have to follow the route of blood circulation, inflow and then outflow method. First of all, see here, this is right atrium, this is right ventricle, left atrium, left ventricle. See, so we have to follow this way, right? First here, then here. So see what is happening here. This is what? Inflow outflow method. Inflow outflow method. Whenever we have to do the heart examination, see, heart post-mortem examination, inflow outflow method. But whenever we have to perform autopsy over a stomach, whenever there will be case of the poisoning, or if there will be anything related to live birth, whenever we have to do post-mortem examination to confirm whether it was a stillborn or live birth baby, right now. So first of all, we are going to ligate just at the lower part of esophagus and then at the lower part of the stomach. Okay, now, so that whatever is there inside, like this should not go up, this should not go down. After that, we are going to remove it out. And the question, so this is called as double ligation method. Answer is B, double ligation method, right now, double ligation method. Now the question is that if we have to give incision over a stomach, we should give over greater curvature or smaller, or a smaller curvature. Always at greater curvature. So double ligation method for stomach, inflow outflow method for heart. Very good, very good. Okay, fine. See, there are 4 methods of the post-mortem examination. See, first is called the Virchow's technique, Letieule's technique, and after that, Ghon's technique, Rocket and Skytail. Let's have the fast revision. See, Virchow's technique, whenever we are going to do the perform the post-mortem examination, when we are going to remove organ one by one, Virchow's technique, we are removing all organs at the same time en masse. This is a rapid technique. This is called as Letieule's technique. Letieule's technique, right? Next, when we have to remove organ block by block, like suppose if I'm going to remove the cervical organ separately, or thoracic organ separately, abdominal content separately, and the genital block by block, Ghon's technique. But whenever we have to do in situ dissection, right? In situ dissection. Basically, suppose if we have to do fetal brain dissection, or whenever there will be a risk of infection like hepatitis B, C, HIV, or radiation. So we are not going to take organs, or we are doing what? In situ dissection. That is called as rocket and sky technique. These 4 techniques are important. Next question. After hanging, dead body is received in the hospital. Which type of incision should be given for the post-mortem examination? Easy question. We have discussed multiple times during the class, right? Very good. So we are going to discuss it now. Dr. Nagamalla, you are asking answer of the question number 2. Yeah, this is double ligation method. No, this is B. Answer will be B. Right? Stomach. Double ligation method. Okay, now question number 3. See here, like whenever we have to do post-mortem examination, we have to give incision, right? Incision. Okay, fine. Overall, most common type, whenever we are going to give incision just below the chin to the pubis, this is called as eye-shaped incision. This is most common type. Okay, fine. After that, suppose if from the acromion to substernal part here, and after that to pubis, this is called as Y-shaped. Okay. Yeah, but whenever incision will be given around the neck like this, and then up to pubis, this is called as modified Y. This is modified Y. So modified Y incision especially done whenever there will be hanging case or ligature strangulation. Whenever incision is given like this, it is called the T-shaped or bucket handle shaped, right? Okay, fine. So all these incisions are given over the anterior part of the body, fine. But what is happening if you are going to receive a dead body from the jail, from any of the custody? So whenever there will be a case of the custodial death, where you suspect that police will beat mostly over the back part, over the posterior part, okay, like this, from acromion to gluteal region like this, X-shaped incision, custodial death. All these are important questions, but on the posterior part, right? Custodial death. Fine. So here after hanging, so if you have to do post-mortem examination, this should be done in modified Y-shaped incision, right? Modified Y-shaped. Next question. Find out the wrong statement. Okay, see. The question is, like whenever you are going to do the post-mortem examination, how many reports you are going to make? How many reports copy you will make? 1, 2, or 3? Yes, very good, Dr. Mallar. Yes, very good. You have to make up to 3 copies. Right now, 1 copy should be given to magistrate. 1 copy should be given to investigating officer. The police who is doing inquiry in post-mortem examination, no, he will be called as investigating officer. Okay, no, last copy should be kept in hospital. Okay, fine. Embalming means what? Meaning of embalming? Artificial preservation of dead body, right? Artificial preservation of dead body. Dead body, what you see in your anatomy lab, that is what? After embalming only. That is called, what is the another name of embalming? Another name of embalming, that is called as the 𝗏𝗏𝗃praxia. 𝗏𝗏𝗃praxia, very good. It should be done at high pressure and low flow. Yes, this is also right statement. Okay. Now question, autopsy should be done before embalming. Yes, this is right statement. After embalming, you cannot do autopsy, right? Because after embalming, you will lose all evidences. Fine. Now, what about option number D? Whenever you have to open the brain, whenever you have to do the autopsy, this part, first incision should be given over the back of the ear here. So this is wrong. In question number 4, answer is D. Facial incision is started over bimastoid process just behind the ear lobe. Easy to understand? Fine. Immediately after death, a test is being performed as shown in photo. Last time there was a question related to this. What is the name of this test? So basically a light is being projected over the web space, and after that you want to see whether there is redness or not. So in this question, I want to check what stoppage of heart circulation is there or not. See here, immediately after death. First of all, see, when do we call it immediate death? Immediate signs are a stoppage of heart, lungs, and brain. Okay, no? Heart, lungs, and brain. Fine. So what are the investigations? First of all, see here, if we have to check stoppage of respiration, and a stoppage of respiration, first is mirror test, feather test, Winslow test. You keep a mirror in front of nose of the person. See, whenever we are going to keep a mirror, obviously you can see some vapor over the mirror, right? You can see blurring vision. If you do not see, no respiration, person is dead. Feather test, feather. If you keep a feather in front of the nose, obviously you can see some movement. If there is movement, person is alive. He's breathing in and out. If there is no movement, gone. Winslow test. You are going to keep a bowl of water over the chest. If you cannot see reflection of light, if you cannot see movement, like any movement, Winslow test. No reflection of light, okay, no, and no movement of water, Winslow test. Winslow test. So these are the tests which we have performed to check what? Stoppage of lungs. Next, stoppage of circulation we have to understand. One is called the Magnus test. This was the picture-based question in December. There was a question, okay, one ligature was applied over the ring, like over the bed of a finger. What is happening here? If you are going to apply a ligature material here, no, like this, right? No, so for sure there will be swelling and the congestion because there is circulation. This is called as ligature test or Magnus test. Okay. Now, next is called a Ďáphyň's test, which is also called the trans-illumination test. If blood circulation is normal, you are going to what? You are going to project a light over the web space, and you can see redness over here. Redness because circulation is normal. If there is no circulation, you will not see the redness there. This is called as Ďáphyň's test. Ďáphyň's test. Okay, see, you have learned that whenever you are going to inject fluorescein dye, you can see what? Yellowish green discoloration. Fine. But if circulation is not there, you cannot see greenish discoloration of skin. This is called as ICARD test. ICARD test. Okay, now, even for the dehydration also, you are going to press the nail bed like this. See, when you apply pressure over a nail like this, first of all, you can see there will be yellowish discoloration. When you remove, after that, you can see there is what? Refilling of blood. Right now, it means circulation is there. It is called as fingernail test. Fingernail test. All these are very, very important. Now you tell me what is the answer here. So basically, this is the trans-illumination test. Trans-illumination test, which is also called as Ďáphyň's test. Ďáphyň's test. What is the another name of Magnus test? Can you answer me? No, Winslow test, Dr. Islam Ali, Winslow test we have performed to check the stoppage of respiration, where we kept a bowl of water over the chest. If there is no movement, after that, if you are going to project the light, you can see what? You can see the reflection of light, right, Dr. Islam? Chalo, very good, right? Magnus test we are applying for what? Heart circulation stoppage. This is called a what? Ligature test. If you apply a ligature material here, there will be swelling, congestion, right now, when person is alive. No swelling, no congestion, right? Chalo, fine. See, this was the question last time because like this is a very important topic now, right? Chalo, fine. Next. Which of the following is wrong? A statement related to eye changes after death. If I ask you, what is the first sign of death? Earliest sign, batao kya hai? No, Dr. Islam Ali, you are not understanding my question. Please hear it again. First sign of death. Now answer me, please. No, Dr. Rachel, Dr. Pawan, no. I'm asking you first sign after death. I'm not asking you first I sign. First I sign nahi pooch raha hu main. I'm asking you first sign after death. There will be loss of voluntary movement. Loss of voluntary movement. But specifically, if I ask you related to I sign, then it should be Kevorkian sign. No, then it will be Kevorkian. Okay, fine. You can also see the tachynoid sclerotica. The best medium to do post-mortem examination time since death is vitreous humor. In vitreous humor, what you are going to see, potassium is the most useful component. Okay, fine. Intraocular tension becomes 0 after how much time? After 4 to 8 hours. This is the question, right? Dr. Syed Zainul, you are asking, sir, in right iliac fossa, green color. Yes, that is the first sign of decomposition. Decomposition is late sign, no? Right? Okay, please understand here that, see, if I say, see, always you have to be careful what examiner is writing in the question. Dekho, agar, see, if I'm saying that, what are the immediate signs after death? Immediate signs after death. Immediate signs after death. See, a stoppage of heart, brain, and lungs. Yeah. Bishop's tripod of life. See, when I say, so like, see, during immediate signs, only cells, see here, no? See, this is called as cellular death. This is called as cellular death. Okay. This is called as what? Somatic death. Right now, somatic death. No, actually, this is called as what? Somatic death. Right now, this is called as somatic death. Right now, somatic death or clinical death. During this phase, aerobic processes are gone. Aerobic processes are gone. But the tissues which can function even in the absence of oxygen, that will be alive. Anaerobic processes will still be there. Anaerobic processes will still be there. Okay, this is what? Somatic death. Hai? Somatic death, right? Somatic death, not cellular. Okay, somatic death. So what is happening here? During immediate and during somatic death, if you are going to apply meiotic or mydriatics, pupil will respond. If you are going to apply, if you are going to shift the dead body to ventilator, it will support. Okay, no? So this is going to be function. But after a few minutes to few hours, when each and every cell of the body will be death, that will be called as what? Molecular death. That will be called as what? Molecular death. Molecular death. Now here, even if you are going to apply meiotics or mydriatics, it will not respond. No response to electrical stimuli, no response to mechanical stimuli. There is a period in between somatic. See, there is a period in between somatic death to molecular death. This period is called as what? This period is called as supravital period. Supravital period, which is very much important for what? Organ harvesting. Organ harvesting. Okay, easy to understand. Chalo, fine. Next important point here. Please understand here that early signs. What are the early signs after death? What are the late signs after death? Early signs and late signs, these are because of what? These are because of the cellular and molecular death. Early signs, obviously there will be eye changes, right now? Fine. After that, there is loss of voluntary movement. After that, what is happening here? Cooling of dead body, which is called as algor mortis. After death, body will become cold. After death, there will be discoloration of dead body. That is called as what? Discoloration. Livor mortis. After death, there will be rigidity of dead body, stiffening. That is called as rigor mortis. What are the late signs? Late signs means what? After a few hours to few days to few weeks to few months. So basically there will be what? Late signs are putrefaction. Putrefaction. When there is no bacteria involvement, this is called as what? Autolysis. Autolysis. Bacteria involvement, that is called as decomposition. Decomposition. What is the most destructive bacteria here? Clostridium welchi. Clostridium welchi. Easy to understand. So these are late signs. It will take few days to few weeks to few months also, where you have learned about what? Say here, like whenever you'll be learning about saponification, right? No, saponification, mummification and all. Fine. So eye changes. Eye changes are very, very important. Please understand that this could be your picture-based question. See, whenever formation of like this, see, because of the deposition of the cellular, because of the drying, because of the desiccation, because of the deposition of debris and dust, there will be formation of like this, two triangle formation like this. This is called as tachynoia sclerotica. Tachynoia sclerotica, right? Tachynoia sclerotica. So this will be brownish black color. Time since death is approximately 3 to 4 hours. Whenever there will be a formation of tachynoia sclerotica, time since death is 3 to 4 hours. Next is, see here, when you are going to investigate with the help of ophthalmoscope, you can see that there will be fragmentation of retinal blood vessels. There will be a fragmentation of retinal blood vessels, right now, blood vessels. So something like this, right now, something like this. Something like a railway sign, cattle tracking sign. And this is actually the earliest sign in eye after death. This is called as 𝗬𝗏𝗃𝗀 sign. 𝗬𝗏𝗃𝗀 sign. This is what? Segmentation of blood column. I know this will occur within seconds to minutes. And this is going to persist maximum for 1 hour. So this is the earliest sign. Please remember all these parts. Related to intraocular tension. How much is the normal intraocular tension? Normal intraocular pressure, this is 10 to 20. Just after death, this will be 12. This will become up to 3 after 3 hours of death. It will be 0 after 4 hours only. Okay. So I hope this is clear to all of you. Next question. Normally temperature falls after death, but in some situation for initial 2 to 3 hours, the dead body may gain heat. See what is happening here after the death. No, Dr. Shubham, no. Dobara aao, wapas aao. After the death, heat regulating center will be shut down. There will be shutdown of heat regulating system. So there will be what? So there will be loss of temperature. There will be loss of body core temperature. Okay, that is called as what? Algar mortis. Cooling of body is called as algar mortis. This is natural. But in some special circumstances, in some special condition, there will be gain of heat. This is called as after the death, there will be gain of energy. There will be gain of calorie, right? Now, post-mortem caloricity. Post-mortem caloricity. This is called as post-mortem caloricity. So if I ask you one question, after the death, you want to check body core temperature. Body core temperature. You have one instrument that is 25 centimeter long. That is called a what? Chemical thermometer. Okay, no? Fine. Now the question is that, see here, most commonly where you are going to insert this apparatus to check the to measure the temperature? Most commonly rectum. Most commonly rectum. But if a person, if the dead body, or if the person who was habitual sodomy person, right? No, sodomy case, they're not the rectum. Overall, most ideal site to measure body core temperature is subhepatic. Subhepatic. This is most ideal. This is most ideal. This is easy method actually. This is the most common method. So now the question is, in which circumstances there will be gain of heat? Whenever there will be muscle contraction. Fine. So, or whenever there, see please, and whenever there will be heat regulation disturbances will be there in diseases like pontine hemorrhage or heat stroke. Whenever there will be muscle convulsion, heat production will be there, right? Like in the tetanus. So this is a bacterial infection. This is the tetanus. What about a strychnine poisoning? Strychnine. This is a plant poison. Plant poison. Strychnine poisoning. Here, situation will be similar to tetanus. Similar to tetanus. So in these two conditions, there will be what? Muscle convulsion. Because of that, there will be heat production. And if there will be excess bacterial activity like septicemia, pneumonia, cholera and all, right? Meningitis, typhoid. In these conditions also there will be what? Heat production. This is called as post-mortem caloricity. Post-mortem caloricity, right? Next, staining was seen over posterior part of thighs and legs. And legs when dead body was getting recovered from the car. See, when you read here, no, when you read up to here only. So now you tell me what was the position of dead body in car? He was sitting on the seat, right now? Like he was sitting on the seat, right? Okay, fine. So when he was in the sitting position, at that time, obviously, like over the dependent part, there will be a staining, no, there will be discoloration. Fine. So over the posterior part of thighs and legs. But when it was recovered from the car, it was kept over the floor. Okay, in supine position. Supine position means what? Face is towards the ceiling. Okay, na? मतलब ऊपर की तरफ देख रहे हो, right? That is called as supine position. Now staining is seen over the back and nape of the neck. What does it mean? Ab batao, which of the following is a right interpretation? Which of the following is the right interpretation of this case? Very good, Dr. Manish Shankar, very good. Okay, no? So do understand that it takes approximately 6 to 12 hours for the fixation. It takes approximately 6 to 12 hours for the fixation of the staining, which is also called as liver mortis. Basically, post-mortem after death, if it is more than 6 hours, staining will be fixed. Even if you are going to do the blanching, like there will not be any blanching. Even if you are going to change the position of dead body, staining will not be changed. The staining will be fixed. Fine. So which of the following is a right statement? Time since death. Since, okay, see, at the time of recovery, at that time, it was over the posterior part of thigh and legs. Now staining got shift. It means what? Death has happened within 6 hours or less than 6 hours. So basically, at the time of recovery of dead body from the car, at that time, staining was not fixed, right? Staining was non-fixed. Easy to understand? Fine. See, like all this part I have taught you so much, right? Like when I have taught you in the classroom, right? Fixation of liver mortis will happen in 6 to 12 hours. So less than 6 hours, like there will be what? Shifting of the color. That is called a what? Staining. After 6 hours, like there will be fixation of liver mortis. Now see here, like this table is extremely important. In which condition there will be different colors of staining. Very important. Basically, see, after the death, there will be purple discoloration. There will be purple or bluish discoloration, right? No, that is because of deoxyhemoglobin. That is because of deoxyhemoglobin. Fine, no? Okay, fine. So the natural color after death is blue color or purple color, blue or purple. But what about carbon monoxide poisoning? Carbon monoxide poisoning and cyanide poisoning. Very good. Repeatedly asked question. This table is extremely important. See here, liver mortis, which is also called as strangulation, which is also called as hypostasis, staining, right? Post-mortem lividity and all, right? Yes, Dr. 𝗙𝗵𝗲𝗃𝗃. Yes, discoloration is called as liver mortis. Liver mortis. Cooling of body is called as algar mortis. Stiffening, rigor mortis. Yes. Okay, very good. Yes, liver mortis is also called as 𝗬𝗵𝗲𝗃𝗃 also, right? So many things, right? Fine. So this depends upon type of hemoglobin. Type of hemoglobin. See what is happening here in carbon monoxide. What is happening whenever there will be Bond's case? No, whenever there will be Bond's case, carbon monoxide will enter. See, in oxyhemoglobin will be there, no? Oxyhemoglobin. Fine. Carbon monoxide, it is going to take hemoglobin away. Okay, it is going to take hemoglobin away because carbon monoxide is having more affinity for the hemoglobin. Oxygen is there, but like useless. Carrying capacity will be decreased. So oxygen is there. So that's why color will be, okay, like this. Cherry red color. So now because of this, there will be hypoxia. Which type of hypoxia? There will be anemic hypoxia. There will be anemic hypoxia, right? Respiratory physiology. Okay, fine. Cyanide, see, cyanide poisoning, cyanide is going to block one enzyme that is called as cytochrome oxidase, right? Cytochrome oxidase enzyme. Because of this, what is happening here? See here, tissues are not able to use the available oxygen. Basically, fourth complex of ETC, right now. So oxygen is available, but tissues are not able to use because of the absence of, because of cytochrome oxidase absence there. So this is what? Histotoxic hypoxia. Here also this is called a what? Histotoxic hypoxia. Do understand, in carbon monoxide poisoning, which type of hypoxia will be seen? Anemic hypoxia. In cyanide poisoning, histotoxic hypoxia. Histotoxic hypoxia. These two are important questions. Here also you are going to see bright red color. Hypothermia because of the vasoconstriction, bright pink. Fine now? All these are important here. Please remember that. See here, hydrogen sulfide. Now the question is hydrogen sulfide, H2S. H2S. Hydrogen sulfide is going to mix with hemoglobin. This will make what? Sulfur hemoglobin, which is greenish color, right? So H2S, bluish green color. Bluish green color. So these colors are important related to your exam. Now, next question. The last act of the person at the time of death is preserved, as shown in photo, which helps in identifying the manner of death. Which of the following is a wrong statement related to this case? First of all, you tell me what was the manner of death? What was the cause of death? This is called as the drowning, right? This is called as the drowning. And this act, what is happening here? Please understand that you need to understand one important point, that after the death, what is happening here? First of all, there will be relaxation. That is called as the, first of all, just after death, there will be primary relaxation of all the muscles. Fine. At that time, ATP was 100%. ATP was 100%. At that time, there was what? ATP was 100%. So actin and myosin, these are the two muscle proteins. Actin and myosin, these were separated. But after a few minutes to hours, what will happen? There will be decrease in ATP for sure. Now this will start falling ATP, 85% to 35%. Okay, fine. Now what is happening here? When ATP will decrease now, actin and myosin, they will come together. They will make a one component like this. This is called a what? Rigidity. This is called as rigor mortis. This is called as rigor mortis. After few more hours, there will be complete dissolution of protein. After that, zero ATP. Now there will be secondary relaxation. So what is happening here? In normal rigor mortis, there will be primary relaxation. After that, secondary relaxation. Easy to understand. Fine. No, rigor mortis aisa hi hota hai. See, there is a rule of 12. There is a rule of 12. It takes approximately, see, this takes approximately 12 hours to appear. After that, it takes approximately 12 hours to persist. And then it will take 12 hours to disappear. Rule of 12. This is for rigor mortis. This is for rigor mortis. Okay. And see here, after that, there will be, after that, there is one rule that is called as Niston's rule. Niston's rule. First of all, this will take, so like if I ask you in which organ you are going to see the rigor mortis for the first time, first organ to get involved in a rigor mortis, what is the answer? First organ. Overall, first organ to get involved is heart muscles, myocardium, first muscle, overall. But specifically, if they are asking first external voluntary muscles, then it will be eyelid. Eyelid. Easy to understand? Fine. First to appear in the face muscle. Okay, now after that neck, last will be there in the fingers and the toes. So this is Niston's rule related to rigor mortis. Okay, now fine. So what I have taught you just now that, it will take, first of all, there should be primary relaxation followed by secondary relaxation. But there, okay, there is a special condition. What is happening here? See, just after their death, there will be sudden spasm of a particular group of muscle, only a particular group of muscles, which is called as cadaveric spasm. Instantaneous rigor. Only voluntary. In a rigor mortis, voluntary as well as involuntary, both are getting involved. Fine. No. So the last act of the person, okay, will be preserved like this. So these are completely in ante-mortem in nature. Ante-mortem in nature. Fine. No? So fine. So this is actually what? Cadaveric spasm. It is also called as instantaneous rigor. It is ante-mortem in nature. Ante-mortem means what? Before death. Fine now. So this can say, so this says that before their death, he was struggling and he wanted to hold something, but he could hold only some plants and weeds in his hand. So the group of voluntary muscles which were in strenuous work just before their death suddenly went into contraction, spasm like this. This is cadaveric spasm. This cannot be produced artificially. So here you do not. So what is happening here? Just after death, sudden spasm, sudden rigor mortis, even without going into primary relaxation. Primary relaxation is absent in cadaveric spasm. This is also correct. Involuntary muscles get involved. No, only voluntary muscles in cadaveric spasm. So this is the wrong statement here, right? Involuntary muscle. See, cadaveric spasm is extremely important topic, extremely important. And see, like every time they're asking one question related to cadaveric spasm. Which of the following is a right match? See, this is actually what, see, your answer please. A, what is the A here? A क्या बताओ? A का नाम बताओ. A is mummification, right? A is mummification. And what about C? Do you think C is a filigree bonds? No. C is marbling. Marbling because of what? H2S and hemoglobin over blood vessels, right? Blood vessels, right? Or marbling. C is what? C is not the Quivorkians and C is tachynoira-sclerotica, right? Tachynoira-sclerotica. Yeah. B is right. B is what? Pugilistic attitude. Pugilistic attitude, which is also called as boxer's attitude, which is also called as the defense attitude. Okay, this will be seen where? Whenever there will be high voltage burns, right? Now, whenever there will be high voltage burns. Yeah, and this is happening because of what? This is happening because of, yeah, this is happening because of the protein coagulation, right? This is happening because of protein coagulation. So right answer is B only. Right answer is B. Right answer is B. Yeah, see, this will be seen in burns condition. Burns, whenever there will be temperature, whenever temperature is more than 65 degrees centigrade, even in burns or even in high voltage electric current, right? Dr. Venu Gopal, you are saying adipose here also looks same. Out of adipose will be different. Wait here. See here, this is called as marbling. Marbling. How to differentiate filigree burn? See, marbling will be around blood vessels. See, there will be so many bacteria. There will be so many bacteria in your gut. Fine. So bacteria will produce more of what? H2S, hydrogen sulfide. Hana? Hydrogen sulfide will get mixed in the blood, which is going to mix with hemoglobin, which is going to mix in the blood. Right now? Easy to understand? Fine. Because of that, along the blood vessel, you can see greenish discoloration. That is what? Marbling. That you can see after 36 hours. Okay, fine. What about, see this one? This is what? This is superficial. Only epidermal. Only epidermal. Right now, only epidermal. So this will be seen in lightning burn. This can be your picture-based question. Lightning burn. So where you are going to see which type of the pattern? For 3 pattern. See, there is a flower-like pattern that is called a what? Lichtenberg flower. Lichtenberg flower-like pattern. Lichtenberg flower. This is also called as arborescent burn. Arborescent burns. All these are important questions related to your MCI exam. Okay. So yeah, now let's understand. See these two. See this. See, this is what? Saponification. Saponification means what? Something like soap or adipocere. Adipocere means what? Adipose tissue. Whenever there will be warm climate, warm and moist climate, moisture will be there. So like situation will be something like this. Okay. And because of the action of the bacteria, it will be, see, this will be bad smelling right now. So there you are going to see what? Rancid butter smell or ammonia smell, ammonia-like smell. This is adipocere formation. Okay. Because of what? Because of the conversion of adipose tissues like this. Okay. Now it will take approximately 3 weeks to 6 months. Mummification. Whenever there will be no moisture, see here, moist is absent. Hot climate and dry climate. Okay, no? When there will be airflow. So what will happen? There will be what? Drying and desiccation of body fluids, no? Fine. So there will be evaporation. Because of that, there will be weight loss. 70% weight loss will be there. No smell, odorless. It will take approximately 3 months to 12 months. Sometimes they can ask you how to differentiate adipocere and mummification. Weight loss, mummification. Odor, bad smell will be there, adipocere. And we already have learned about Kevorkian sign and tachynoia sclerotica. Right now? Fine. Next question. Like one student was asking about this question, right? Highlighted zone in the given picture can be correlated with which of the following? Batao. First of all, you tell me, what do you understand by seeing this picture? What do you understand by seeing this picture? Over the right iliac fossa, greenish discoloration is there, right? Greenish discoloration over right iliac fossa. This is the first external appearance, first external sign of decomposition or putrefaction. Putrefaction. Why over right iliac fossa? Why over right iliac fossa? Because this is your large intestine. And this part here, you are going to see cecum, right? Cecum is a free floating, no? And there you will be having more accumulation of bacteria. This is more superficially lying to right iliac fossa part, no? So there you will be having more discoloration, greenish discoloration. That's why because of the free floating cecum there, right now. So this is the first external. So out of these four, which one is associated? Which one you can correlate with putrefaction? This is what? 𝗏𝗃's dictum. 𝗏𝗃's dictum. What is the meaning of 𝗏𝗃's dictum? 𝗏𝗃's dictum. Rate of decomposition in, see, remember here, rate of decomposition in air, water, and soil. It will take 1 week for the decomposition in air, 2 weeks in water, and 8 weeks in soil. If dead body, see, suppose the dead body is buried under the soil. If dead body was actually thrown in water, or if dead body will be kept on the earth, under the air, in air. So where you are going to see a fastest putrefaction? Obviously in air, right now. After that in water, and then soil, right now. So remember, this is called as 𝗏𝗃's dictum. A body will decompose in air twice as rapidly as in water and 8 times as rapidly as in earth. This is called as 𝗏𝗃's dictum. 𝗏𝗃's dictum. So answer is C. What about compos mentis? Compos mentis. Do you remember what is the meaning of compos mentis? Compos mentis. Yeah, this question was there, right? Okay. So what is the meaning of compos mentis? Suppose if a person is going to die and he wants to give a will, or he wants to give any kind of testament, right now. So what is happening here? This is the duty of a doctor. Whenever we are going to talk about what? Dying declaration. Just before the death, if a person wants to give some kind of declaration and all, fine, no? If he wants to confess anything, who is going to record? Anyone can record, okay, no? Fine. So this is the duty of doctor to certify that before giving declaration, a person was mentally sound and completely conscious. This is called as compos mentis. Niston's rule we already have learned. Niston's rule is seen in a rigor mortis, where we have seen corpus delicti. What is the meaning of corpus delicti? Meaning of corpus delicti? Essence of crime, right? Okay, next. Dr. Diksha, Niston's rule we have applied in a rigor mortis. First of all, there will be externally, there will be involvement of eyelids, right now, eye muscles. Rigor mortis, Niston's rule. Next, as per the pattern of hanging, which of the following ligature mark will not be seen during post-mortem examination? So basically, first of all, you see this one. See, this is complete hanging or incomplete hanging. This is complete hanging or partial hanging? Yes, incomplete hanging, right? So what is happening here? When a body is completely hanged in air, okay, now when none of the parts of the body is going to touch the ground or anything, that is called a what? Complete hang. 100% in air. Body is suspended in air completely, that is complete hanging. When any part of body is going to touch the ground, that is called as partial hanging. This one is complete. This one is incomplete. This one is complete. This one is incomplete, or you can say partial hanging. So what will be the ligature mark of hanging? Whenever there will be complete hanging, no, complete hanging ya kaise banate hain batao? You can apply on yourself also, fine, no? So like suppose if you are going to apply like this, no, like this will be up like this. So first of all, you see here, no, so this will be what? Above thyroid cartilage, suprathyroid. See, now see this line. This is oblique or horizontal? This is oblique. Now you tell me, see this part here, you are going to see that like, okay, no, like during at the place of what ligation here, there will not be any mark because like it will be loose here. Fine, no? Whenever there, so remember, IOS, incomplete, oblique and suprathyroid means above thyroid, incomplete hanging. Complete hanging में क्या होगा ये? Incomplete, oblique and suprathyroid. But whenever any part of the body is going to touch the ground, now this will go down like this. So this will become what? Below thyroid. This will become what? Below thyroid, right? Below thyroid. And it will usually become what? This will not be oblique, but this will become what? Horizontal, like this. In partial hanging, this can be seen below, okay? Usually horizontal, or you can say transverse. This will be incomplete. Always above? No, no. Okay, now they will be asking you in this manner, how to differentiate hanging and strangulation. Hanging means what? See, hanging means like this. Hannah? So see here, oblique, suprathyroid, and this will be incomplete here. Fine, no? But if someone is standing behind me, if he is going to ligate me like this, see here, no? See, this one is a strangulation. So there, first of all, ligature mark will be complete circle like this, circle, complete. Fine, no? So first of all, this will be what? Infrathyroid. It will not be oblique, but it will be transverse or horizontal. Infrathyroid, transverse and complete. ITC याद रखना, strangulation. IOS, infrathyroid, oblique and suprathyroid. Hanging. Ligature mark, you can anticipate one question. How to differentiate hanging and strangulation? How to differentiate typical hanging and partial hanging? Okay. Now the question is, what is the meaning of typical hanging and atypical hanging? Typical hanging and atypical hanging. Can you answer me? Whenever a knot will be placed, exactly over the back of the neck, exactly over occiput. And so basically knot will be placed centrally, centrally over the occiput, exactly back pe. But if not, you are going to place over angle of mandible or below chin. Atypical hanging. Angle of mandible or below chin or submental, below chin. If I ask you, what about judiciary hanging? What about judiciary hanging? Means as per the Indian law, as per the judiciary system, where you are going to place the knot over the angle of mandible or angle of jaw. Fine, no? Mandibular. So there you are going to see the fracture of a vertebra. Which vertebra? C1, C2, C3, C4? C2 fracture, C2 vertebra fracture. That's why it is also called as what? Hangman's fracture. Hangman's fracture. Okay, no? So hanging is a type of asphyxia, right now? Hanging. Fine. Now, if I ask you, what is the surest sign of ante-mortem hanging? Can you answer me? What is the surest sign of ante-mortem hanging? Surest sign. There will be what? Dribbling of saliva. Dribbling of saliva is what? Surest sign of ante-mortem hanging. Dribbling of saliva. Fine. Because see what is happening when a rope or ligature material is applied over here. No, there will be irritation over salivary glands. Because of that, there will be what? Dribbling of saliva. Right. One more thing is that where knot is being placed over this cervical sympathetic chain, eyes of the same side will remain open. This is called as what? 𝗵𝗵𝗃𝗃. These two are what? Ante-mortem sign. These are ante-mortem sign. Surest sign is dribbling of saliva. Repeatedly asked question in MCI. Dribbling of saliva. Fine. So I hope all these points are completely clear to you. Like you cannot take a chance to miss the points related to ligature marks. How to differentiate complete hanging and partial hanging. How to differentiate strangulation and hanging. Very, very important. Okay. Okay. Dr. Akbar Shah is asking glove and stocking hypostasis also. Chalo, theek hai, baat kar lete hain. See, where do we see glove and stocking hypostasis? Glove and stocking. Hypostasis. Hypostasis means what? Staining. Basically, when you have received a dead body, you can see that discoloration is seen over the forearm and hand and the legs. So where you are wearing the gloves and stockings. So whenever, so what is happening here? Wherever there will be dependent part, there will be accumulation of blood, right now? Fine. No? So this will be seen in a case of hanging. Easy to understand? Fine. Okay, fine. See, there are different types of asphyxia. Now, if mechanically, if you are going to produce, if you are going to throw a rope from behind and apply around the neck, like this picture number 1, this is called as garroting. This is called as garroting. This is called as garroting. A type of garroting is shown in picture number 2, where an iron collar is applied around the neck, and after that there will be fixation of screw. This is called as what? Spanish windlass. Spanish windlass. This is a judicial method of execution in Spain, Spanish windlass. Picture number 3. If 2 bamboo sticks are placed around the neck, and after that, if there will be neck constriction, it is called as 𝗵𝗄𝗃𝗃. Picture number 3 is what? 𝗵𝗄𝗃𝗃. So 𝗵 means what? Bamboo, actually, no? Bamboo sticks. Okay. If you are going to constrict the neck under the bend of your elbow, it is called as what? It is called as mugging. It is called as mugging. All these can be your picture-based question or a direct question. Very easy to understand, but repeatedly asked question. Easy to understand. I hope this is clear to all of you. Next. Dr. Kalki Kumar, that part will come. Bastinado is different thing. That is a mechanical. That is the torture method that I will teach you. Don't worry. Okay, bastinado. Yeah, that is more. Yeah, that part will come. Dr. Ajit, aajo chalo aajo. Okay, Dr. Mannan, yes, very good. About during the post-mortem examination, these are the findings as shown in photo. Which of the following is wrong related to this method? Yeah, this one. See, first of all, see, like, yeah, answer me this question. After that, I will explain you smothering and all. Everything I will explain you, don't worry. First of all, you see here, first of all, you can see that over the face, there are what? Like there are the particular hemorrhages. You can see the sign of, okay, you can see cyanosis and the congestion. So for sure, this is a type of asphyxial death, for sure. Okay, see, like this will not be suicidal for sure. So this is 100% homicidal murder in nature. Now the question is, what is the mode of death? Okay, fine. See, what is the meaning of this one? What is the meaning of garroting? Applying ligature material around the neck. So there you will see sign of a struggle, abrasion or whatever. You'll be seeing over a neck, no? Over a neck. Here you can see laceration, bruises, abrasion, everything over face like this. Okay? So, ab batao, do you think this is a case of garroting? No, this is not the case of garroting, but now this is the case of a smothering. Now we are going to understand. Suppose if I'm making a diagram like this, this is nose or this is face. Chalo, theek hai, kuch samajh lo. Okay. Ye iska neck hai, right? Okay, this is neck. And this is face part. Hai na? Okay, my diagram is like the diagram is different, but you have to understand it. Okay. Chalo, theek hai. See here, whenever there will be blockage of external respiratory passages here, and external respiratory passages, mechanical, this is called as what? This is called as smothering. Okay, na, smothering. Smothering. Whenever there will be blockage of internal respiratory passages here, whenever there will be blockage of internal respiratory passages here, if it will be accidental, if it is accidental, it is called as choking. Accidental, it is called as choking. But if someone has pushed a paper roll inside your mouth or the cloth roll inside the mouth to block your internal respiratory passages, homicidal is called as what? Gagging. Gagging. Easy to understand. This is called as gagging. External. So whenever you are going to see the signs and symptoms over the face, over the nostrils, over the lips, over the chin, abrasion, contusion, laceration over here, this is the case of what? This is the case of smothering. Smothering, abrasion over neck, strangulation or throttling or garroting. Easy to understand. I hope this is clear to all of you. Is there any confusion? Sir, but neck side, some fracture, why not garroting? No, see here, no, like see here. Here, like when you see this picture, what do you see? More signs, everything, maximum you are going to see over face only, no? Face only, right? No? Face only. So this is what? Homicidal from external. So this is the case of a smothering. Fine now. Easy to understand? The main cause of death is smothering. Smothering. Main cause. Fine. No, discoloration over the neck, maybe because of the hypostasis or maybe because of the shirt collar and all. Fine, no, like it could be possible. But here, when you see main thing, main laceration, main injuries over face, this will be what? Smothering case, smothering case. Okay. See here, when you see nail abrasions or bruises over the neck like this, over the neck like this. This will be the case of a strangulation, or you can say the throttling. Okay, no? Okay, fine. But if you can see over the face, over the nostrils, over the lip, this will be what? Smothering. Now there is a case that is called the Burking method. Right now, Burking method. Fine. No? Burking method. Fine. We're going to say Burking method. Fine. See, there is one method that is called as traumatic asphyxia. See, there is a type of asphyxia that is because of any of the accident. Suppose if there will be a stampede, if there will be, like building collapse, and if there will be, like 50 kilo, 50 kilo, or like a heavy object that will be placed over the chest of a person. After that, what is happening there? There will be what? There will be mechanical obstruction. He is not able to breathe in and out. So maybe in a type of, maybe in a case of accident, stampede, or building collapse, this is called as what? Traumatic asphyxia. So in this case, you will see what? Reddish discoloration over the upper part of the thorax here. Okay, now this is called a mask like this is called what? Mask ecchymotic. Okay, fine. So now what is happening here in the case of the Burking method? In a case of the Burking method, what is happening here? Two people, two friends are going to invite one person. They will offer them alcohol. When he will be somewhat intoxicated, one friend is sitting on the chest and he's blocking his nose and mouth. And one friend is going to pull his legs and he's going to drag him around the room. And they will be doing like this until that person is going to die. So whenever there will be a Burking case, there will be laceration, struggle injury over face also, over the thorax also. Here also you will see what? Ecchymotic. There will be mechanical compression of the thoracic cavity also. Fine. So this is Burking is a combination of a smothering and traumatic asphyxia. Fine. Easy to understand. Chalo, theek hai. So I hope all these points are clear to all of you. Burken here. Next. Fine. No? A person is survived and death occurs at a later stage after removal from water. Either the person himself comes out of the water or he is recovered alive, but due to complication of submersion, he died at a later stage. So basically what is happening here? First of all, there was the drowning, but he got survived. He died after a few days because of the secondary complications of the drowning, right? No, so that is called as So that is called as secondary. So that is what? Near drowning. This is called a what? Near drowning. See, there are two types of drowning. One is called the typical drowning. One is atypical. Water is going to enter into the lungs and it is going to replace the air. So typically it is going inside. This is called as wet drowning. Wet. So when water is going to replace the air, water is going to mix with the surfactant, and after that, whatever the product you are going to get outside, that will be soap-like, frothy discharge. Froth you are going to see in wet drowning. So this can be fresh water or salt water. But atypical drowning, just after insertion of water, what is happening here? There will be what? See, because of the parasympathetic nerve supply, what is happening there? There will be sudden laryngospasm. Because of this, water will not enter into the lungs. If water does not enter, this is called as atypical drowning. And that's why it is also, see, that's why you are not going to see any frothing. So this can be seen either in the dry drowning, immersion syndrome, submersion, and near drowning. Do understand all these points are extremely important. See what is happening here. Meaning of the dry drowning. See here. See, when water does not enter into the lungs and because of the sudden inrush of water, there was sudden laryngospasm. And after that, patient is dying. This is what? Dry drowning. But now when a person will be thrown in cold water, Because of these sudden, see what is happening, which is going to stimulate vagal nerve endings. Vagal nerve ending. Basically, what is happening? There will be sudden cardiac arrest due to vagal inhibition of heart. This is called as immersion syndrome, also called as submersion inhibition, vagal inhibition, or hydrocution. Okay. Next is submersion of unconscious. If a person was having alcohol, if a person was sitting at the swimming pool, he was having alcohol, and after alcohol intoxication, he got unconscious, and after that, suddenly he fell in the swimming pool. So before drowning, he got unconscious. He got unconscious. That is called as submersion of. That is called what? Submersion of unconscious. Or if a person was sitting at the swimming pool, he got heart attack, or maybe epilepsy, or whatever. Or maybe he was in the drunk state. Submersion of unconscious. Near drowning or secondary drowning or post-immersion syndrome. First of all, after the drowning, he got survived. After a few days, he died because of the secondary complication, because of the sepsis, because of the encephalopathy. That is called the near drowning. These 4 points are important. 4 points are important. See, every time they ask you one question related to drowning. Related to drowning also, don't expect very, very easy questions. Sometimes now, because these questions they have not asked in last few years, so they can ask you this time. You have to be very much careful. Okay, now related to drowning, we can understand some more points. See, whenever you are going to do post-mortem examination, you can see this kind of, like this kind. So whenever your hands will be in water for longer duration, yes, you will be having washerwoman's hand, no? Washerwoman's hand. This can be your image-based question. You can see piloerection like this. This is called as what? Goose-like skin or 𝗙𝗵𝗄𝗃. 𝗙𝗵𝗄𝗃. There is a test that is called as Gettler's test. Gettler's test. So on the basis of chloride content, in blood, we are going to differentiate whether this was a freshwater drowning or seawater drowning. This is called as Gettler's test. Diatoms, these are what? Unicellular algae, which will be found in water. After the drowning, that is going to mix in the blood, and this can be, this can go into the blood circulation even after many years. If you do post-mortem examination, if you do bone marrow aspiration, and if you can find diatoms are actually what? Algae. If you can find out diatoms, it means yes, this was the case of what? Drowning. Gettler's test and a diatoms test. Repeatedly asked question in MCI. These two are related to drowning. So where do we use Gettler's test? Whenever we have to differentiate fresh water and salt water on the basis of chloride content, right? Chloride content. Okay. Next question related to mechanical injury. Identify the type of injury shown in photo. Okay. So first of all, we have to understand, see here, like one is called the blunt injury. One is called the blunt. Second is called as sharp trauma. Sharp trauma or the blunt trauma. Blunt means what? Whenever we did not have the question paper. Achha, you did not have the photo in question paper. Okay, see, while uploading, they might have forgotten. Maybe, or like they might have missed it. Okay, no? Okay, they might have missed. Okay, no problem. Okay, chalo, okay, now you can. No, but so many doctors are saying, no, like they had. Okay, chalo, no problem. Chalo, okay, now you can understand here. Okay, no, understand here. Okay. Okay, fine. Dekho, see, one is called the blunt trauma. Second is called the sharp trauma. What is the meaning of blunt trauma? See, whenever any hard object like a stone, hammer, or anything hard, whenever there will be hard hitting by a hard object with a broader surface, that is called the blunt. So like either if there will be abrasion or laceration or bruises, right? Bruises or contusions. These are blunt trauma. Sharp cut injury means like if there will be sharp and light weapon like blade, blade hoga, so that is called as what? Incised wound. Incised wound, incision wound. Okay. Sharp object, but heavy cutting object like axe, So what is the name of that injury? Chop injury. But if there will be a pointed object, if there will be a pointed object and it is going to be penetrated into the body like stab injury, stab injury. Fine. So these are examples of sharp cut injury. These are examples of the blunt injury. Now the question is that after seeing the photo, how you are going to differentiate? Please understand that. See, when you see this photo, see, this is laceration or sharp cut injury. First of all, you tell me. Dr. Shubham, yes, actually like whenever there will be knife cut injury. See, please understand. See, do you think there is fast bleeding or slow bleeding? Here it is what? Slow bleeding, sluggish bleeding, right? Sluggish bleeding. Second, you see the margin. Margin is what? Irregular margin, right? No, irregular and uneven, right? No, irregular and uneven margin. Irregular and uneven margin. Irregular margin, uneven margin, or you can say irregular border and slow bleeding. This is what? Laceration. What is happening here? Because of the hard hitting object, because of the pressure, what is happening here? Even the blood vessels or nerves, that will be what? Fully crushed. And because of this, there will be what? Slow bleeding. Slow bleeding. There will not be fast bleeding. But whenever there will be sharp cut injury, sharp cut, blood vessels will also be sharply cut. So in sharp cut injury, there will be fast bleeding, profuse bleeding. Fine. So this is a case of laceration, right? This is a case of laceration, and this is the case of laceration. One more thing is that whenever you are going to see the wound, there will be what? You can see that there will be the presence of tissue breaches. Fine now? Very good, very good. Means the blood vessels will be intact between two borders. Now you see this photo. See here. See, do you see very, very fast bleeding? Do you see profuse bleeding here? No, sluggish blood flow, first of all. And after that, see the margin here, like somewhat even, but after that, see, after that 100%. See, this looks like incision. This looks like incision, but not completely incision. Okay, so this is called a what? Incised looking laceration. This is what? Incised looking laceration. Right now, so this is also called as split laceration. Split laceration. Yeah, in bony prominence, yes, Dr. Karthik, yes. So here, so this is what? A split laceration, right? Okay, incised looking laceration. Chalo, theek hai, next. Okay, now see here. Now there are, so there are different types of laceration. One we have learned, that is what? That was what? Split laceration. Now, if there will be a shearing force at fast, okay, at higher level of energy. So what is happening here? Whenever a part of the body will get detached, if only skin will get detached, it is called as a flaying. Only skin. See, rotating for maybe in the road traffic accident, you can see when it is going to tear off only the skin, flaying. Skin plus subcutaneous tissue, degloving injury. And when skin is subcutaneous tissue of a scalp, scalping. See picture number 1, picture number 2, picture number 3. Only skin flaying. Skin plus subcutaneous tissue. This is what? Degloving injury, right? And here, scalping. Okay, scalping, right? Easy to understand? Chalo, fine. So overall, these are what? These are the type of what? Avulsion injury, you can say. Avulsion injury. Very good. See, these can be your picture-based questions. Next. Cerebral contusion, you can see here in this photo. So whenever there will be head injury, at the point of impact, just after impacting like this, okay, now just at the point of impact, cerebral contusion over the point of impact is called as Coop injury. Coop injury. Because of this, see, like there can be internal movement of the cerebral cortex also. No, suppose if it is going to backside here, and after that, if there will be contusion, this was the point of contact, but here you are going to see what? Because of the hitting of the cerebral cortex against the wall of the posterior part of the skull, this is called as counter coup. At the point of impact, coup injury. Opposite to the point of impact, counter coup injury. Counter coup injury. So here answer is A. Counter coup and coup injury. Next. After the road traffic accident, a patient was brought to emergency. X-ray of pelvis is shown here. As per the nature of injury, where actually patient was sitting in the car, you can see that yes, there is what? See, there is what? Actually, posterior hip dislocation, you can see, right now, posterior hip dislocation. You can see fracture of femur also, no? Fracture of femur also, right? Fine. So basically, this is a case of what? Very good, very good. No, very good. So please understand that here. Okay, now you understand here. Suppose if a person, suppose if there was, see, in the car, like in front, there will be driver and there will be front seat passenger, no? Front seat. So when I'm saying about driver, if I ask you about out of these two passengers, where you are going to see ankle fracture, leg fracture, foot fracture, where will you say? Like in a case of the driver, and in a case of the driver, yes, easy to understand, because he will be having accelerator, brake and clutch. Fine, but what about the person, like your front seat passenger, like this? Dashboard injury. He or she was enjoying the ride, right? So what is happening here? So whenever there will be sudden deceleration, sudden stoppage of the car, dashboard fracture. Right now, you can easily understand after seeing this photo, right? So there can be posterior dislocation of hip. There can be what? There can be fracture of femur. Fine. So this is called as dashboard fracture. Dashboard fracture. Answer is B. Okay, this thing I've explained you in the class, right? Next, after a bomb explosion, a person has suffered multiple bone fractures. This is due to why not at the back seat? Because see, like this kind, you may not be able to sit like this when you will sit at the back seat, no? Fine. So this is actually what? Dashboard fracture. Okay, fine. What about? See, whenever there will be bomb explosion, first of all, there will be what? Because of the waves. See, because of the waves, there will be injury, right now. So that is because of the blast wave, that is called the primary blast injury. Some people, Atangwadi people, what they do, they will add glass pieces and nails in a bomb. So after the explosion, they will flying projectiles. Because of that, there will be aberration. There will be what? Contusions. There can be lacerations. So what is this? There can be lacerations. Is this making a triad? Is this making a triad? Yes, this is called as the Marshall's cut triad, right? Old question. This will be seen in secondary blast injury, secondary because of the flying projectiles. After that, see what is happening here. First injury, primary injury was because of the blast wave. After that, flying projectiles like nails. After that, because of the energy, victim will be displaced from one place to another place. After that, he will be hit against the wall. Here you are going to see what a skeletal injury, skeletal fracture, right? No, skeletal, tertiary blast injury, tertiary. After that, maybe there can be what? Like building collapse, right? There can be building collapse. Because of that, there can be injury that is called the quaternary blast injury. After a few weeks to few months to few years, because of the chemicals and radiation, there can be some infection. No, fine. No, that is what? Quaternary blast injury. So a skeletal fracture will be a skeletal fracture. It will be because of the tertiary blast injury. Tertiary blast injury. Fine. So what is the most common organ to be damaged because of the because of primary blast injury? Overall, most common. Okay, tympanic membrane, tympanic membrane. After that, lungs, and then GIT. Over the earth. Okay. Next, in a type of torture method, victim is immersed into water, taken out after some time, and given a chance to confess. Very, very important. Okay, no, very, very important. And most of you are writing wet submarine, right? Acha. Chalo, let's learn it. Beating on the soles. Beating on the soles, phalange, or it is also called the bastinado. Bastinado. Slapping over ears, it is called the telephono. Forced immersion of head in water which is already contaminated with the urine or feces. This is called a wet submarine. Applying a plastic bag over the face until suffocation, dry submarine. Okay. See, like if you are hanging a person like a parrot, it is called the parrot's perch. And like this is called the parrot's perch. Electric shock over genital, this is called a what? Cattle prod. Now, when you are going to immerse a person into water, you are going to take him out, you are giving him time to speak the reality, to speak the truth, to confess. If he is not speaking the truth, again you are going to immerse him in water. Dubo dubo ke marna, right? That is called as dunking. Dunking. Black slave. In old time in America, all the black people, like whoever, like if they used to commit any, like if they used to do anything negative, they used to be punished. Hot iron metal rod used to be inserted into their anus. That is called a black slave. What about this one? Picture number 1. If you are making a person to sit on this wooden part like this, like on the wooden horse, this is called as sawhorse. Sawhorse. Fine. So now you answer it, please, all these part. See, this is sawhorse. And this is what? This is called a phalange or the bastinado. Okay, what about picture number 3? Yeah, this is called the parrot's perch. Picture number 4, telephono. Picture number 5, yeah, this is also what? Phalange or bastinado. Picture number 6, forced immersion into the contaminated water, forced immersion of head. This is called a wet submarine. 6 is wet submarine. 7, applying a plastic bag around the face for suffocation. It is called a dry submarine, right? This is the dry submarine. 8, this is called as dunking. Dunking. So now you answer me, please, this one. Answer is dunking. Yeah, answer will be this only, no? So this will be dunking only, right? This will be dunking, right? 15th answer, Dr. Abdul Karim. You're asking 15th question. What was that? Yeah, 15th answer will be split laceration, right? Split laceration. So this is what? Incised looking laceration. Question number 18 you are asking. Question number 18 was this only, no? After a bomb explosion, a person has suffered multiple bone fracture. That will be skeletal injury. That is because of the tertiary blast fracture, no? Tertiary blast injury. Fine. No, see, actually, Dr. 𝗧𝗲𝗹𝗵, there will not be any fast track revision for psychiatry forensic because you do not have time. Like these two are small subjects. So like that's why like even in their test and discussion, I'm doing a type of fast track revision only. Okay, so multiple things I'm explaining. Okay, this is not just a test and discussion, right? 𝗏 versus counter 𝗏. Okay, Dr. Pavan. See here, just after a strike over the, see just after the strike, see here, see a strike of head against the wall. So this is the primary impact. If there will be cerebral contusion here, at the anterior, at the primary impact, if there will be contusion, it is called as 𝗏 injury. But because of this, see, there will be the posterior movement of cerebral cortex inside also, no? So the posterior part is going to hit against the wall of the posterior part of the skull. Fine, no? If there will be injury at the posterior part or at the opposite part of the impact, that is called as counter 𝗏. Counter 𝗏. Okay, fine. Question number 9. क्या था? Yeah, this was the case of the cadaveric spasm where only voluntary muscles are getting affected, no? Not involuntary. Okay. Chalo, Dr. Ashwini is asking fresh water and the salt water drowning, right? Okay, question number 10. Right answer was the B, pugilistic. अच्छा देखो चलो वो fresh water and the sea water मैं explain कर देता हूँ Gettler's test. Okay, so that can be your question. चलो ठीक है. See यार ये बताओ. Suppose, see here. As we know that like in our blood there will be chloride content. Sodium chloride है ना? Sodium chloride right now. Fine. Sodium chloride 0.9%, right now 0.9% in our blood isotonic. Now you tell me if a dead body will be thrown in fresh water. See, I'm just explaining like some of the confusions now. You can have a small break. After 5 minutes, we can continue with 20th question. Okay, now fine. Suppose if dead body will be thrown in fresh water. Okay. And if a dead body will be, or maybe if drowning will occur in sea water. As you know that sea water is having more salinity. Sea water is actually more saline. Saline level will be approximately 2 to 4%. 2 to 4%. 2 to 4%, which is actually hypertonic, and fresh water will be having very, very less salt content, approximately 0.5%. Fine now? Okay, no? Chalo, fine. So now, when I see here fresh water and isotonic, so this is actually what? This is the normal isotonic. Now you tell me salt will flow from higher concentration to lower concentration. If dead body was recovered from fresh water, so now what do you think? Salt will be flowing from human to fresh water or fresh water to that person? Higher concentration to lower concentration. Fine. So here there will be flow of salt from what? Human to fresh water. Now when you do post-mortem examination, it will be less. It will be less than the normal. So it means what? Body is recovered from fresh water. Now, if there was the drowning in sea water, which is hypertonic. So now you tell me in sea water, there will be a flow of salt from human to sea or sea water to human. Obviously, sea water to that person, right now, sea water to that person, right now. Easy to understand. So when you do post-mortem examination, you have increased level of chloride content. Decreased level of chloride content, fresh water drowning. Increased level of chloride content during post-mortem examination, sea water drowning. This is called as Gettler's test. I hope this is clear to all of you, right? आ गया समझ में? Okay, chalo, question number 20th now. Yeah, answer me please. A 35-year-old lady was found in a robbed room, lying in a pool of blood. On forensic examination, there was an entry wound of size 2x2 on the right temporal region with tattooing and blackening. See, tattooing and blackening was there. Tattooing and blackening around the wound. There was also an exit wound with beveling at the left temporal region. Opposite side. Means like there was entry wound and the exit wound. Okay, fine. On further examination, 2 bullet fragments were found inside the brain parenchyma. Which of the following could be used to determine the distance? I want to ask you the range of firing. Range of firing. Fine. From which the weapon was fired. This question was asked in AIMS and NEET PG also. Okay. So the best out of these 4, see, like you can use the cloth also, but here since it was in the head only, so distance wala kya hoga? Distance ke liye most important will be here what? Hair. How to understand? Please, like see this question here. See, suppose if a person was standing here, okay, no, suppose if a person was standing here. So this is called the point blank shot. This is called the contact shot. And if a person was standing in the range of flame, if a person was standing in the range of gunpowder, and if a person was standing beyond the range of flame and beyond the range of gunpowder here, okay, no? So this is called as contact shot. This is in the range of flame. This is called as close shot. In the range of, beyond the range of flame, but in the range of gunpowder. Okay, this is near range, near. Okay, now the victim number 1, victim number 2, this is victim number 3, this is victim number 4. And beyond the range of flame and gunpowder, he will be considered as at the distant range. Fine. Easy to understand. So now you tell me, when a person is standing in the range of flame, basically in the close shot, do you think there will be burning over the entry wound? Yes, there will be burning for sure. Yes. Okay. Do you think there will be singeing of hairs? Singeing of hairs. Yes, it will be there. And singeing of hairs means what? Like hair will be shrunken like that. No, shrunken like this. Fine. Hair, singeing of hairs. Do you think after that there will be tattooing effect? Because after the flame, the remain gunpowder will go there and that will get deposited. Fine. So do you think there will be, yeah, there will be the tattooing? Yes, it will be there. Okay, fine. So chalo, theek hai. So now see here, whenever a person is in, he is in the range of close shot. Fine, no? Burning will be there, singeing of hairs will be there, tattooing will be there. Now you tell me, what about victim number 3? When he is standing beyond the range of flame, but in the range of tattooing. Hai na? So here, no burning and blackening, only tattooing will be there, right? Only tattooing will be there. Only tattooing will be there. Only tattooing in the near. No burning. No burning. Easy to understand. And what about here? Like in the distant shot, no burning, no blackening, no tattooing. Only entry wound, like circular wound. Easy to understand. Fine. What about this one? What about victim number 1? Victim number 1. When gun is in close contact. Now, do you think externally you are going to see burning, singeing of hairs, anything tattooing? No. Outside, you will not see anything. But inside, yes, inside, internally, during the post-mortem examination, internally, you can see along the track, right? Along the track. Now, what will be the shape of wound at the C? In the point blank shot, because of this, what is happening here, see here, like there will be blast effect. No, so here you are going to see shape of a wound will be like a stellate shaped blast effect, stellate shaped, Shape of the wound will be either a stellate or it will be something like a cruciate. Apart from that, any distance, at any distance, there will be what? Circular wound. Easy to understand. So what is happening here? To measure the distance, we should check what? Singeing of hairs. Out of these four options, best answer is what? Hair. Easy to understand. Next question. While performing autopsy of a gunshot injury case, a doctor recovered a bullet from the dead body. After 3 days, police arrested a person and seized his gun. Police is asking the doctor to match the bullet. If it was fired from the same gun, which of the following methods can help in the confirmation? So do you think DNA fingerprinting? No. So this question was actually asked in last time, I think maybe in AIMS or maybe in NEET PG, somewhere it was asked, somewhere. So this is, so we can detect it, but with the help of bullet fingerprinting. Bullet, see, please remember about bullet fingerprinting. I think during the class, I think I missed this topic. So let's finish it here. Bullet fingerprinting means what? See, a bullet fingerprinting means what? First of all, whenever you are going to see a bullet, no. See, whenever you are going to see a bullet, there will be markings over the bullet. Whenever you are going to see the bullet, whenever you are going to see the bullet, you will be seeing a marking. First of all, if you see, there will be the primary markings. So this will be happening because of what? Please understand that whenever you are going to fire one arm, so this is the barrel of a gun, this is the barrel of a gun. And so because of the rifling, because of the grooving, when the bullet will go out like this, because of the riflings, one imprinting pattern will be there over the bullet. Because of the rifling, these markings are called as the primary markings. Easy to understand. But do understand that every barrel will be having some kind of defects. Every barrel, because none of the guns is actually perfect. Because of those irregularities in the barking, like in the barrel, there will be, because of the manufacturing defect, because of the irregularities in barrel of different gun, there will be one more marking. Those markings are called as secondary marking. Suppose if there is a manufacturing company of a gun, suppose if there is a company of a gun, and they manufacture 1,000 guns, and they manufacture 1,000 guns. In all 1,000 guns, actually the primary marking will be same for sure, same. But in all 1,000 guns, because every guns will be having some minute defects inside, because of the manufacturing defect, irregularities in the barrel, those markings are specific to every gun. Those markings are called as secondary markings. Secondary markings will be different in all 1,000 guns. So this is, so what's happening here? So first of all, now what you are going to do, when police has given you one gun, when police has given you that gun, now again you are going to fire that gun. So that bullet will be called as test bullet. One will be the test bullet, second will be the murder bullet. Now you have to check secondary markings on both bullet, secondary markings on both bullets. Fine. And you are going to compare in a microscope, the new microscope. This is called as comparison microscope. Who discovered it? This was discovered by Calvin Goddard. Okay, he is known as father of forensic medicine. He is known as father of forensic. forensic medicine. So one bullet you are going to keep here, one bullet you are going to keep here, and you are going to check for secondary markings in both the gun. If secondary markings are similar, it means yes, this bullet was fired from the same gun. So if they are going to ask you one question, bullet fingerprinting is about primary marking, secondary marking, tertiary marking, or whatever. Answer will be what? Secondary markings, because this is individual to a particular gun. Fine. So this is what? Bullet fingerprinting. Next, which type of bullet expands on striking the target, causing more destruction? It is called as what? Answer, please. Dum-dum bullet. Okay, no? Dum-dum bullet. See here, so dum-dum bullet, what is happening here? So this will be what? Half-jacketed, semi-jacketed. Semi-jacketed. Fine, but half will be. So after striking the target, dum-dum bullet will expand more. Because of that, there will be more destruction. Now, what is the meaning of the tandem bullet, which is called a piggyback bullet? If you have an unused firearm, if you open the firearm for the first time, if you pull the trigger, bullet will not come out. Second time, whenever you are going to pull the trigger, now two bullets are coming together. Two bullets are coming together like this. This is called as piggyback bullet. Piggyback bullet, tandem bullet. Yawning bullet. See, yawning bullet means what? If after firing the, if bullet is going in this manner, like this. Yawning bullet. What is the meaning of the tumbling bullet? See, if end-to-end rotation is there of a bullet, this is called the tumbling bullet. Tumbling bullet, right? Okay, fine. Souvenir bullet. If there is a patient of gunshot injury, fine. Yeah, Dr. Islam, yes. Yes, so that's why these are called as what? Atypical bullets, right? No, atypical bullets, right? These are not the typical bullets. Fine, no? So whenever you are going to operate a person, you can see that there is a old bullet inside the body. And so that is like a gift inside the body. Souvenir bullet. Retained bullet. So what is happening? I do understand that. See, there will not be any side effect, but since bullets are made up of leads, so there will be higher risk of lead poisoning in souvenir bullets. Fragile bullets means what? After striking the target, these are going to be fragmented. Fragile bullet. Next is called as incendiary bullets. Incendiary bullets means what? See here, okay, army use it, or maybe military people, they are using it. This is made up of phosphorus. After striking the target, it will cause fire in the target. It is called as incendiary bullet. Incendiary bullet. Incendiary. Ricochet bullet. Ricochet bullet. What is happening is, suppose if the main target, if the victim is standing here and you are going to fire from here, fine now. So before hitting the target, this is going to hit at any other place. After that, this is going to hit him. This is called as ricochet bullet. Ricochet bullet. Okay, ricochet bullet. Now see, in night time, whenever army, they are using this kind of bullet. After firing, whenever bullet will be in sky, bullet will be on the path, this will show a line so that you can easily trace the path. This is called as tracer bullet. Okay, one important point here, that is called as, one important point, please answer me. What is the meaning of this phenomena? Old question, repeatedly asked question. Kennedy phenomena. Where? See, whenever you are going to get a case of the gunshot injury, whenever you will be seeing wound, right? Multiple wounds are there, multiple wounds are there. So after that, you are going to wash it. So after that, there will not be blackening, there will not be tattooing and all, fine. So whenever you are going to wash it, whenever you are going to suture it, after that, it will be very, very difficult to understand which one was entry wound and which one was exit wound. It is called as Kennedy phenomena. Right now, easy to understand. So overall, what does it mean? Iatrogenic alteration will make it difficult to understand whether it is entry wound or exit wound. This is called as Kennedy phenomena. Next. A 15-year-old girl was claimed to be kidnapped. On interrogation, she claims that she is not a minor and left home with the person on her own will. Court ordered for her age estimation. Okay. Do you think this is marbling? Answer me, please. Okay, yeah. Yes, Dr. Daniel, yes, it will be severe. Okay, fine. So whenever I have taken the X-ray of elbow, you can see there is what 100% ossification, means all bones are completely fused. If all bones are completely fused, then age must be 16 to 17 years. 16 years. So age should be more than 16 years. Okay. What about a wrist? What about a wrist? When you can see that there is complete ossification over ulnar bone, no? So age will be around 17 years for sure. But whenever you are going to see that there is complete ossification over radial bone, now age should be approximately 18 to 19 or more than 18 years for sure. You have to see what ossification center of different bones. So that's why you have to memorize ossification of all other bones. They can give the X-ray of any other bones also. Fine now. So while seeing, so after seeing these two pictures, I can say that age of that female is more than 18 years. Right now, ossification means what? There will be what? See, whenever there will be complete ossification. So complete ossification at elbow will occur after 16 years. Right? Over the ulna, 17 years. Radius after 18 only. Easy to understand? Fine. If they would have given you one more X-ray that is called as ischial tuberosity. Now, if they would have given you all these X-rays were given in AIMS question, I'm telling you. And after that, they have asked the question. Now you tell me, whenever you are going to see the complete ossification over ischial tuberosity, after, batao kitna hai? Yes, now age will be more than 20, right? More than 20. Fine. Please understand that I have not seen this question in MCI before, but I have seen this question in AIMS and other PG exams. You can anticipate this question. Okay, fine. Very important question for June exam. Dr. Shubham, this will be more than 20 years. Okay, 20 to 22. Next. An abandoned dead male fetus was found and brought by police for autopsy. The following was the report. Eyelashes were seen. Eyes are open. Pupillary membrane absent. Crown rump length is 23 centimeter. Weight around 1000 grams. What is the estimated age of the fetus? As we have learned about, and most of you can do mistake here, but please understand. Yeah, we are going to understand in a proper manner. One is called as a rule of Morrison, and one is called a what? Rule of 𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 See here, rule of Hasse means what? Like a square root of crown heel length. Rule of Morrison, you are going to divide crown to heel length by 5. Okay, but in this question they have not given heel length to nahi hai na. In this question they have given crown rump length. Crown rump length, easily they can play with your knowledge. This is crown rump length given in the question. Crown rump length and crown heel length both are different. From here to here, if it is going to measure, this is called the crown rump length. And from, see here, from the central part of the head Now this is called as crown heel length. Easy to understand. This is crown rump length. This is crown heel length. Crown rump length is equal to 2/3 of crown heel length. Fine. No. Now how much will be the crown heel length? How much will be the crown heel length? This will be 3/2 of 23. This will be approximately 34.5 centimeter. You can say approximately 35 centimeter. Now you have crown heel length. Now you can divide it by 5. Now what is the age? Age is 7 months. Age is 7 months. So please be careful about crown rump length and crown heel length. Crown rump length and crown heel length. Okay, chalo fine. Next question. Which of the following is a wrong statement related to dentition? Related to dentition. See, dentition is a difficult topic. Okay, just understand it here. See here, first of all, there will be the primary dentition, and after that there will be secondary dentition, right now. So whatever the primary dentition means the actually the temporary dentition, or you can say milk teeth, and milk teeth, which are going to fall. So overall, how many primary teeth will be there? Yeah, these are going to be 20 in number. 2, 1, 2 in each quadrant. 2, 1, 2 in each quadrant. 2 incisions, 1 canine, 2 molars in each quarter. 5 into 4 equal to 20. There will not be premolars in primary dentition. But what about secondary dentition, which is also called the permanent dentition? 32, 2, 1, 2. Rule is 2, 1, 2, 3. 2 incisor, 1 canine, 2 premolar, and there will be 3 molars in each. Now, which will be the first tooth to erupt? First tooth to erupt in primary dentition. First of all, first primary tooth will be developing. First primary tooth will be erupting at 6 months. First permanent tooth will be erupting at 6 years. ये याद रखने का है, ठीक है ना? First. Okay. Next, which is the first tooth to be erupted? First, lower central incisor. Lower central incisor. After that, upper central incisor. After that, upper lateral incisor, and then lower lateral incisor. This will develop at 6 months. This will 7 months, 8 months, and 9 months. So now you tell me at the age of 9 months, how many teeth will be there? At the age of 9 months, how many teeth will be there? 4 teeth. Right? Easy to understand? Easy to understand? Fine. Now next mnemonic you can write, that is what? I am chief minister. First of all, there will be what? Incisor. First of all, incisor. After that, second will be what? Molar number 1. Third will be canine 1. Fourth will be molar number 2. Now you have to apply the rule of 6. First incisor. See here, first of all, I am chief minister. It will erupt at the age of 6 months. First molar, age of 12 months. First canine, age of 18 months. Second molar at the age of 24 months. All primary teeth completed. Now, what about the secondary dentition? What about the permanent teeth? Mnemonic is Mama is in pain. Papa can make medicine. See, this is molar number 1, central incisor, lateral incisor, and this will be first premolar, second premolar. See, this is C stands for canine. After that, second molar and then third molar. At the age of 6 year, 7 year, 8 year, 9 year, 10 year, 11 year. This is at the age of 12 year. And last tooth to be erupted will be third molar in the age of 17 to 25. Do understand that in between the age of 6 and 11 year, in between the age of 6 and 11 year, there will be mixed dentition. Number of teeth will be approximately 24. So age of a child is 9-year-old. 9-year-old. How many permanent teeth will be there? 16. 16 will be there. Easy to understand? Now solve the question, please. 4 teeth will be there in a 9-month-old baby. Yes. In the primary dentition, absent will be premolars. Yes. Okay, fine. Number of permanent teeth in 9-year-old will be 14 or 16. Just now we have calculated, no, it should be 16. So C is a wrong statement. Gustafson's method, please understand that yes, this is used to estimate the age by dentition in adults. Fine, no? So Gustafson method, here especially what you are going to check, you are going to see the root transparency. See, this much is more than enough to solve all the question related to dentition. Okay. Chalo, my next question. A piece of cloth was submitted by police obtained from a crime scene with some dried stains. On microscopic examination, after adding picric acid solution, yellow needle-shaped crystals are seen. So see, related to semen, Florence and Barberio, every time they are asking one question, Florence and Barberio. So basically, क्या है यहाँ पे yellow देखना या फिर brown देखना? Please understand here, no? See, Florence test and Barberio's test. Florence test. If you are going to see dark brown color, brown rhombic crystal, Florence test. Brown will be there because of the choline. But if you can see yellow needle shaped, yellow shaped, Barberio. Barberio. FB, Florence, brown. BY, Barberio, yellow color. Yellow will be there because of the spermine. So yellow color hai Barberio's test, right? No, Barberio's test. Repeatedly asked question. Florence test, brown color. Barberio's test, yellow color. If you can remember this one, this is more than enough to solve this question. Next, how many points of comparison are needed to match as proof of identity in fingerprinting? So basically fingerprinting is also called as what? Dactylography, right? Dactylography. Who discovered it? Sir Francis Galton. So it is also called as Galton's test. Galton's test. Okay, fine. First Bureau of fingerprinting was established in Kolkata, India. Okay, fine. So how many points are needed here? After the biometrics also? Okay, 10 to 12. So now the question is that fingerprintings will start appearing in which month of intrauterine life, or in which week? Fingerprintings will start appearing in the 12th week of intrauterine life, and it will be completed by 24th week. How many points are needed to be compared? 10 to 12 matching. Most common types of fingerprinting is what? Loop, right? Loops, holes, arch, composite. Remember claw, right? Claw. This is the, see, please understand that fingerprinting, this is the most reliable method of identification. This will be different even in monozygotic twins. Even in monozygotic twins. Okay. Monozygotic twins. This is not inherited. Now the question is that, see, where you can see that there can be the permanent alteration of fingerprinting. In which condition there can be permanent alteration of fingerprinting? radiations, leprosy, electric injury, and skin grafting. All these are important questions related to fingerprinting. Okay, fingerprinting. Okay, now see here, since I have taught you just now that Galton's test. Now there are 3G in forensic. One is Galton's test, Galton's. Second is Gettler's. Third is Gustafson's. Where do you see Galton's test? Fingerprinting, right? Fingerprinting. Where we have learned about Gettler's test? Drowning, right? Drowning. Where we have seen Gustafson's test? Age estimation by teeth. Dentition. Okay, all these are frequently asked questions. Next. Okay, now let's learn about all the poisoning cases. After ingestion of an organic compound, a patient is presented to emergency with complaints of burning sensation over skin. On further examination, there is meiosis, hemoglobinuria, and white eschar on skin. Urine sample was taken, and you can see there is what? Green urine after the oxidation. In which poisoning you see green color urine? Phenol poisoning, right? Phenol poisoning, that is also called the carbolic acid poisoning, right? Carbolic acid poisoning. Please understand that one question related to, okay, one important question related to carbolic acid or phenol poisoning. In all acidic poisoning, gastric lavage should not be performed, right? Gastric lavage is contraindicated in all acidic poisoning except carbolic acid, right? Except phenol. Easy to understand? Please understand that whenever a person is going to ingest the phenol, what is happening here? So like, first of all, it is going to destroy, it is going to damage nerve endings in the beginning. So that's why there will be burning and numbness. After that, there will be what? White eschar. So there will be meiosis, that is called a carbolism. Green urine, carbolyuria. There will be meiosis, constriction of pupil. Right now, and even the metabolite can be deposited in the cornea. Okay, a corneal deposition over the cartilage also. Damage of PCT, convoluted tubule damage. Fine. All these are features of carbolic acid poisoning. Next, very, very important. A hat industry worker is present to hospital with neuropsychiatric symptoms. Along with the recent personality changes, he is irritated, behaving in a weird manner, disoriented, having insomnia and dementia. So basically, which poisoning is this? Which poisoning? Can you answer me? This is mercury poison, right? Mercury, Hg, hydragyrism, right? Mercury poison. Very, very good. Okay, no? So see here, please understand here. No? So see, when a person is working in a hat industry or glass blowing industry. So first of all, there will be what? See, first of all, please understand. Yeah, okay, let me explain you. After that, this will become very, very easy for you. Yes. So first of all, there will be what? Shaking palsy, or you can say there will be what? Danbury tremors will be there. Okay, fine. So where you are going to see this kind of the shaking palsy? First of all, in hands. After that, lips, tongues, and arms and legs. In the beginning, first of all, there will be worsening of handwriting, early feature. After that, even patient will not be able to dress himself. Fine now? So this is what? Shaking palsy. Now, same person who is working in the hat industry, after the chronic exposure, he will be having neurological problems. He will behave like a mad working in hat industry. That's why it is called mad hatter syndrome. Personality changes, neuropsychiatric symptoms like irritability, shyness, dementia, and all. These are seen in glass industry and hat industry, which is called as erethism. Right? Answer is B. Some other diseases of mercury poison we are going to learn. Mercury poison is extremely important. Even if there will be deposition of mercury vapor, okay, no, in anterior lens capsule, you can see picture like this. Okay, no? Brown color. There will not be problem in any vision. No issues, but you can see like there will be brownish deposition. This is called as mercuria lentis. Third is acrodynia. Acrodynia means what? This is also called the pink disease. Pink disease. This is a type of hypersensitivity reaction because of mercurous chloride. Okay. So because of this, hand will become fully pink and the puffy, painful and all. Fine now. So this is called as acrodynia, mercury poison. Mercury poison in young age. Minimata disease in a see like a group of people who were living at the bank of a river, and at the opposite side of the river there was an industry, and they used to discard the mercury and whatever the waste material was there, like in that river only. So fish, everything was contaminated, and those people, they used to feed on those contaminated fish. So they had what? Mercury poison. That place name was actually Minimata. I know. So now everyone used to have what? There was the problem in hand coordination, speech problem, gait problem. See, like sometimes they used to have what? Rigidity and seizures. These are Minimata disease. Minimata disease. That is also because of mercury poison. Mercury poison. Okay, Dr. Sashi. Right now? Chalo, fine. No, I hope this is clear, right? So Minimata is the name of the place. I know. So like in the beginning, doctors were not able to, they were not able to understand the root cause. After that, they saw that all the patients who were coming there, they were getting back from the same population. Hannah said they all were exposed to contaminated water and fish. That place was Minimata disease. Next is Hunter-Russell syndrome. Hunter-Russell syndrome. So whenever there will be chronic exposure by the mercury, now patient is having what here? Deafness. Here patient will be having, you know what? Deafness. Fine. And after that, there will be what? Cerebellar ataxia also. Hunter-Russell syndrome. So do understand, as per the clinical scenario here, in this question, answer will be what? Erethism, which is also called as Mad Hatter syndrome. Mad Hatter syndrome. So, okay, Dr. Sashi Murugan, everything is clear, right? Okay, chalo, next. Okay, fine. Next, dry gangrene and a spontaneous amputation. Answer is what? Arsenic. Arsenic will cause vasospasm. Arsenic will cause vasospasm of the peripheral blood vessels. So because of that, there will be lack of blood supply. Lack of blood supply will be there. So because of that, there will be what? Ischemia, necrosis. This is also called as what? Black foot disease. Black foot disease. Dr. Sai, answer of the 29 was erethism, right? Yeah, this is also called as black foot disease because of arsenic poison. Arsenic poison, right? Now, because of arsenic poison. Some other questions related to arsenic. Please understand that this is a type of poisoning. After that, a person will be having what? Gastroenteritis. It will mimic like cholera. Cholera. Black foot disease. You can see there will be raindrop pigmentation, black, leukomelanosis and all. See, you know, raindrop pigmentation. Fine. Raindrop pigmentation. There will be hyperkeratosis of palms and feet. I know. So, yeah, and after that, if you are going to see the nails, right? Nails, there will be what? Meeslines, right? Meeslines, or full name is Aldrich Meeslines. All these are important questions related to arsenic poisoning. See, I hope now this question you can easily solve. A patient presented to OPD with hyperpigmentation over his palms, black, raindrop pigmentation. What is the answer now? Long-term ingestion of what? Arsenic water. Yes. Arsenic poisoning only, no? Arsenic poisoning. Yes. Fine. No, this is what? Raindrop pigmentation. Raindrop pigmentation. Very easy question. This question I think everyone can solve. Question number 31, option B is the right answer. Question number 32. Lead poisoning only, no, lead poisoning. These are the features of plumbism, no, plumbism, plumbism. Lead is blocking what? Lead will create problem in heme synthesis, heme synthesis. Anna? Which enzymes lead will be blocking whenever there will be lead poisoning? ALA-dehydratase, ALA-dehydratase and ferrochelatase. Anna? Ferrochelatase. Right now? Fine. So like whenever there will be problem in heme synthesis, for sure there will be anemia, right now? Anemia. And all these features we have learned: abdominal pain, constipation, right now. There will be colicky pain, blue lines over gums, right now, which is called as Burtonian lines, right? Burtonian lines. Burtonian lines. Sometimes there can be encephalopathy in young age group, lead poisoning, plumbism. All these are plumbism. So how to treat? How to treat? EDTA, right now? Chelating agents or even the penicillamine. Next, plant poison. What is the active ingredient of this plant seeds as shown in photo? Chalo, take a see the plants I'm going to show you. See here, we are going to learn about Ricinus, Abrus precatorius, Semicarpus anacardium marking nut, Calotropis giganta. First of all, you see here Ricinus communis. Okay, so active ingredient is ricin, right now. After that, Abrus precatorius, Abrus precatorius, right now. So here, active ingredient is aberrin, aberrin. Third is Semicarpus anacardium, which is called as marking nut. Marking nut. Very, very important. Okay, see, either you will get this question or you will get this question. I know. So marking nut mein kaun sa hai? Semicarpal or the bilavanol. Hai na? Bilavanol. These are what? Active ingredients. Calotropis giganta. This is what? Calotropis giganta. Please understand that most of these plants are used as what? Abortifacient, hai na? Abortifacient, or like sui needle and all, which we already have learned. Please understand. Okay, see, like most importantly, picture-based questions are very, very important related to active principle of these plants. Fine. Okay, next question. After a snake bite, a patient is presented with severe muscular tenderness. There is swelling and myonecrosis at the site of a snake bite. Which snake bite can cause these symptoms? Now you tell me what is the name of A snake. A में कौन सा snake है? A में बताओ. A जहां पे brown का white bands है ना, that is what? It is a krat. Okay, it is a krat. Okay, what about B? B is actually what? Viper, right? B is viper. What about C? C is common cobra or the king cobra. चलो ठीक है. यहाँ पे देखो, यहाँ पे क्या होगा? See, always understand here ना. See this picture. See you. Bispectacle. See bispectacle, no? See, you can see this two here, no? Two. See here, bispectacled or speckled, like spectacles are being worn by the common people. So common cobra. How to understand common cobra? How to understand common cobra? There will be what? Bispectacled. 2 eyes are there, no? 2 glasses. But in the king cobra, like it does not wear any spectacles. Fine, no? So C is common, D is what? King cobra. Now see, now you understand as per the clinical situation. Now you tell me the snake was neurotoxic, myotoxic, or blood toxic, hemotoxic. Yeah, as per the clinical condition, a snake was actually myotoxic. No, myotoxic. C snake कौन सा होगा आउट ऑफ इसमें कौन सा है ना? Yeah, options are actually wrong. Okay, options are actually wrong. Okay, C snake will be C here, but actually, yeah, there is no C snake. Okay, so okay, चलो fine. This question को आप लोग इसमें रख लेना क्योंकि ना पिक्चर बनाते ना मेरे दिमाग में कुछ और चल रहा था, ठीक है? Like when I was framing question, I was making वो neuro and all ये सब चीज को mix up. But please understand that चलो ठीक है. Like this question you can understand. Like first of all, this can be your picture based question. First of all, this can be your picture based question. Okay, 1 mark सब लोग अपना ठीक कर लो, कोई बात नहीं. 1 bonus mark. So please understand that C snake will be actually the myotox, you know, C snake, where you are going to see what? Where you are going to see actually the pain will be there, muscle tenderness. Okay, viper will be having what? Viper will be actually what? Vasculotoxic, no? Vasculotoxic, right? Okay, see, like after that you can see there will be a problem in, like there will be problem in the DIC and all, like you can see like there will be clotting problem. Neurotoxic में कौन-कौन से आएंगे? King cobra, common cobra, there will be the rat will be there right now. Okay, there will be the rat. Okay, neurotoxic. Chalo, fine. Okay, now you tell me, see, whenever you are going to see the snake bite case, whenever you are going to see the snake bite case, snake bite case, see, we are using anti-snake venom, anti-snake venom. Okay. So now you tell me, in all conditions, are you going to give anti-snake venom? Not in all conditions, because it is made out of horse serum. It is made out of horse serum. And there is high risk of anaphylaxis. So that's why anti-snake venom is always given along with adrenaline. Whenever you see that local inflammation is more, okay, no? See, whenever serious symptoms are more, right? No, serious symptoms are more, right? So whenever symptoms will keep on increasing, then you have to give anti-snake venom for sure. If there is less swelling, symptoms are not increasing, symptoms are decreasing, that wait and watch. Only symptomatic treatment. That's it. Are you going to see, please, if after the snake bite, are you going to apply a tourniquet? Are you going to give incision? Are you going to do suction? Answer is no. No tight tourniquet, but only a small type. See, like only a soft tourniquet. Actually, that is a bandage, soft. That is called the Sutherland bandage, Sutherland bandage. So that can be applied, but no tight tourniquet, no incision, no suction, because there can be what? Negative pressure. Fine. Yeah, Dr. Manishankar, no bringing animals to hospital. Yes. Chalo, theek hai. So related to snake bite, one question every time they are asking. Next question. A disoriented patient is brought to emergency. He has a dry mouth. And the throat. There is decreased salivation. His skin appears to be very, very dry and hot. When everything is dry, pupils are dilated. Family members are saying that he started having symptoms when he returned from railway station. Which poisoning you are suspecting here? So basically, this is a case of what? Dhatura poison, right? Dhatura, everything will be dry. Dhatura poison, which is also called as roadside poison, or railway side poison. What is the active ingredient of the Dhatura poison? Hyoscine, hyoscine or scopolamine, right? Scopolamine. See, this is the plant photo here, no? So this is the seed here. So please remember this photo. So this can be what? Physostigmine is the, physostigmine, Dr. Shivam, that is the antidote here, right? Atropine, scopolamine, or hyoscine. Remember this one. Whenever organophosphate poisoning will be there, no, everything will be wet. Like there will be lacrimation, there will be sweating, there will be urination, there will be diarrhea and all, right? There will be sweating and all. Fine. That will be organophosphate poisoning. Be careful. Next. Yeah, love filter. Yeah. A 19-year-old girl was brought to OPD. On physical examination, labia majora separated. Labia minora projecting outside the labia majora. Foreshore tear present. Vagina is roomy, but hymen is intact. Hymen is intact. How to differentiate a virgin and... See, first of all, understand how to differentiate a real virgin and real non-virgin. Virgin, 100% virgin, 100% non-virgin. First of all, see here, labia majora. No, labia majora. These are actually thick, firm, fleshy. They are going to oppose each other in such a manner that you will not be able to see the vaginal opening. 100% virgin. 100% virgin. But if you see labia majora are relaxed, you will see vaginal opening is somewhat open. You can see it. So it means what? She is non-virgin. If a female is completely virgin, you cannot see labia minora from outside. It will stay under the labia majora. Fine, no? But if a non-virgin is, if a non-virgin female is there, you can see that labia minora is projecting outside labia majora. Clitoris, which is analog of penis, where there you can see what erection. Fine, no? In a virgin female, this will be small. Non-virgin, this will be big. When I talk about vagina, 100% virgin female, see, this will be like vaginal opening will be small. This will be narrow. Okay, no? Fine. But if there is a non-virgin female, vaginal opening will be roomy, loose. Hymen completely intact in virgin. Hymen will be ruptured in non-virgin. Now the question is that who is called as a real virgin and false virgin? Real virgin who never experienced sexual intercourse and has intact hymen. Okay, fine. False virgin means what? Who has experienced sexual intercourse, but hymen is also intact. Now, how to differentiate? If a real virgin is there, no, hymen will be there and hymen will be non-elastic. It will be very, very tight. Hardly a tip of the small finger will go inside, hardly tip. But false virgin, hymen is there, but it will be loose, elastic. Easily up to 2 fingers you can insert. So now what will be the question here? Vagina is roomy, but hymen is intact. She is actually what? False virgin. False virgin. Pseudo virgin, right? Next. 16-year-old rape victim with 22 weeks of gestation is presented to hospital. Which of the following statement is wrong? You have to read it carefully. Which of the following is a wrong statement? Very good, Dr. Shubham. Yeah. Gynecologist can abort the fetus upon the patient request. Patient is only 16-year-old female. She will give consent or her family members or guardian will do. male doctor can examine her with a female anatomy. Yes, this is also right only, no? I'm asking which one is wrong. No, Dr. Gokul. Age 18 or more than, then a female can give the consent. If age is less than 18, she will be considered as minor. So wrong will be D. Wrong will be D only, no? Age is 16 only. Next. So now please understand MTP Act. Last time this was the question. MTP Act, new MTP Act. Earlier, opinion of only one doctor was enough up to 12 weeks of the pregnancy, and two doctors up to 20 weeks. Earlier, as per the 1971 or 70, MTP Act jo tha. Now, as per new act, opinion of one doctor is required up to 20 weeks. Opinion of two doctors is required more than 20, or you can say maximum up to 24 weeks. Maximum up to 24 weeks. Fine now? So like this was the question last time in December. This was the question. No? See here. MTP, medical termination of pregnancy, can be performed maximum up to how many weeks of the pregnancy? Maximum up to 24 weeks. Maximum up to 24 weeks. Easy to understand? What about this one? Mother got pregnant when she was already pregnant. A female who was already pregnant, now there is, bolo. One is called the superfecundation, second is called the superfetation. First of all, superfecundation means what? Superfecundation. Suppose if there is a female, her name is Anna, husband name is Mark, and her boyfriend name is Jack. Boyfriend name is Jack. Anna and Mark both are white. Both are white. Husband, wife, both are white. Last night, what happened? She had sexual intercourse with her husband. In early morning, she had sexual intercourse with her boyfriend, and the boyfriend is actually black. Now, there was the fertilization of, see here, there was the fertilization of 2 ova. Okay, no? So 2. And now there will be delivery of a twin child. And one is black, one is white. One is black, one is white. Fine now? This is what? See here, fertilization of 2 ova in same menses, in same menstrual cycle, in same menses, same menstrual cycle. When sexual intercourse was done in a short span of time, same menses, fertilization of 2 ova by 2 sperms, 2 ova by 2 sperms, but in the same menstrual cycle. This is called as what? Superfecundation. But suppose if a female who is having septate uterus or double uterus, there was a fertilization in the January, again next month in February also there was fertilization of 2 ova. So here actually 2 menstrual cycle, 2 ova, 2 sperms, but 2 menses cycle, superfetation. So what is happening here? See, this is superfecundation. Same age, same menstrual cycle. One is white, one is black. Superfecundation. So one baby will be elder, one will be younger. This is called as superfetation. I hope this is very, very important. Please understand that superfecundation, this will be dizygotic twins only, 2 ova, 2 sperms, but same menses cycle, same menstrual cycle. Fetation mein kya hai? There is a word that is called Fitation, two menses cycle, two menses. Easy to understand. Fine. No, one is elder, one is younger. Superfetation, superfecundation, same age. Fine. Please remember this part. So here answer will be what? So as per this picture, as per the clinical condition, mother was, so in January she was already pregnant. Fine. No? Again in February she got pregnant. So mother got pregnant when she was already pregnant. This is what? Superfetation. Superfetation. Which of the following condition can be associated with the given picture? In a child, this is a case of what? Child abuse, or you can say battered baby syndrome. Battered baby syndrome. Battered baby syndrome. What is happening here? Whenever there will be child abuse case, no? So this can be because of what? Like maybe if there will be unwanted child. So sometimes, okay, parents will shake the child like this. So because of this, there will be what? Intracerebral hemorrhage inside. Okay, no? So this is called as what? Shaken baby syndrome. You are going to see hemorrhage in subdural hemorrhage, right? Shaken baby syndrome. Whiplash injury, where we have seen whiplash injury in road traffic accident. Whiplash injury, whenever there will be sudden acceleration or a deceleration. Okay, now suddenly like hyperextension of neck followed by the hyperflexion. Because of that, there can be contusion over a spinal cord. That is what? Whiplash injury. Fine. Now, this shaken baby syndrome is also called as infantile whiplash syndrome. Infantile whiplash. Infantile whiplash. Dr. Shubham, hyperflexion followed by hyperextension. Both will be seen there in whiplash injury. Both. है ना? पर आगे जाके फिर पीछे आएगा ना head. Fine. Okay. Fine. Okay. All right. No, Dr. Shubham, this question will not be there. कि hyperflexion है या extension है. Both will be there. Both will be there. Both will be there. Okay, no, because of both only there will be whiplash injury. Fine. No. So when you are going to see that there will be what? Child abuse. Whenever you are going to see different wounds of different ages. Okay, no, and whenever there will be discrepancy in history given by the parents and the nature of wound, that is called a what? Child abuse. Battered baby syndrome, also called the 𝗬𝗵𝗲 syndrome, right? No, shaken baby syndrome or infantile whiplash syndrome. Subdural hemorrhage. अच्छा ये बताओ, where in which type of hemorrhage you are going to see lucid interval? In which type of head injury? Lucid interval. Lucid interval will be seen in extradural hemorrhage, right? No, extradural hemorrhage. Now tell me, during lucid interval, if a person is going to sign a contract, will it be valid? Yes. If he is going to sign a contract, yes, it will be valid. Okay, now because this is a period of consciousness. This is a period of consciousness in between two periods of unconsciousness. Okay, chalo fine. Next question. A test for live birth is performed where in autopsy weight of lung is measured in relation to body weight. What is your answer? See here, one is the before respiration and one is after respiration. See, before respiration, see if you check weight of a lung in relation to weight of body, no respiration, no gas, so this will be approximately 1/70. But after the respiration, this will become how much? After the respiration, this will become 1:35. Easy to understand. This is called as Plauquet test, right? This is called as the Plauquet test. I know some other tests, hydrostatic test, Rigor test, or first life test. Here we are going to check the specific gravity of lungs, specific gravity. Now, see if a respired lung will be there, respired lungs. There will be air, if you are going to do post-mortem examination, if you are going to do the dissection of lungs, if you are going to keep in water, it will float, means air is there. If it will not float, no air. Hydrostatic test, first life or regard test. Breathless test. If a baby is going to breathe in, right now, breathe in, right? So air will go into a stomach also, stomach and bowel. You take out a stomach outside by double ligation method. If you are going to keep in water, there will be air bubbles, right? No, Breathless test. Redden's test. This is a type of gelatinous embryonic tissue in the middle ear. Just after the birth, after respiration, this gelatinous structure will not stay there. This will go inside. If baby did not respire, it will be there. If baby has respired, this will not be there. This is called as Redden's test. Redden's test, right? Now, Fodder's test. Here we are going to recheck the weight of lungs. Respired lungs will be heavy for sure. Unrespired lungs will not be that much heavy. Easy to understand. All these tests are extremely important. Next, how much fine can be imposed by Chief Judicial Magistrate? Can you answer me? See, remember seven hierarchy of criminal courts. Highest level, Supreme Court. After that, High Court. After that, Session Court. And then Assistant Session Court. And then Chief Judicial Magistrate, First Class Judicial Magistrate, and then Second Class. See, this is the hierarchy of, hierarchy of the court. Now, do understand how much fine they can impose. See here, Supreme Court, High Court. First of all, understand how much power do they have. Maximum punishment which they can give. Supreme Court, High Court, and Session Court. They can give any sentence. Maximum they can give what? Death sentence easily, right? Death sentence, maximum. Okay, no? Death sentence. Do understand that they can ask you lowest court which can give death sentence is Session Court. Session Court. Whenever Session Court is going to give death sentence, they should always be approved by High Court. Now, after that, Assistant Session Court, Chief Judicial Magistrate, First Class, Second Class. Remember the rule of 13710. 13710. Assistant Session Court, they can send a person to jail maximum for up to 10 years. Chief Judicial, 7. First Class, up to 3. Second Class, maximum for 1 year. Now, how much fine they can impose? Up to 5, up to Chief Judicial Magistrate, unlimited. Unlimited fine they can impose. First Class, 10,000. Second Class, only 5,000. Old question, you can anticipate. So answer will be here, D. Chief Judicial Magistrate. Next, leading questions are not permitted in. What is the meaning of leading questions? Answer should be only in yes or no. Answer should be only in yes or no. If advocate is asking, did you see that murder? Yes or no? Yes, sir, I have seen that. Okay, no, yes. Okay, see, the length of sword was 15 centimeters. No, sir, I have seen from by. No, answer me yes or no. Yes or no. Right now, yes or no. So this is what? Leading question. Leading question. Leading questions can be asked. Now do understand here, whenever there will be proceeding of court, whenever there will be proceeding of court, first of all, there will be direct examination. Direct examination. After that, there will be what? Indirect examination. After that, re-examination. Re-examination. So the main advocate who has invited the witness, first of all, he is going to ask the question. So that is called the see the first, or maybe like suppose if the advocate is fighting for the victim, he will be considered as the public prosecutor. And if the advocate is fighting for the for the accused person, he will be called as the defense lawyer. So this one is the public prosecutor, this one is defense lawyer. First examination will be done by the public prosecutor. Here leading questions are not allowed. After that, defense lawyer is going to ask the questions so that more reality can be brought. During the indirect examination, leading questions are allowed. Leading questions are, you can say, like there will be what? Cross-examination. Who will do this? Second lawyer. So during this, leading questions are allowed. Again, first lawyer will do the examination. Re-examination, it is not allowed. Easy to understand? Chalo, fine. Now the question is that here, yes. See here, now second, what is the meaning of hostile witness? Hostile witness means what? A person, suppose if one witness is there, on a first hearing, he gave his statement. On second hearing, he changed his statement. So whenever a witness is going to when a witness keeps on changing the statements, it means either he is under the pressure or he is bribed. That witness is called as hostile witness. Leading questions can be asked anytime to him. Now next is dying deposition and dying declaration. Very, very important. In India, we are practicing what? See here, in India, we are practicing dying declaration or deposition. Now, please understand that what is the meaning of dying declaration? Just before the death, if a person is going to give any kind of declaration, like 𝗏𝗏𝗏𝗏 case or 𝗏𝗏𝗏𝗏 case nahi, wo case tha, 𝗏𝗏𝗏𝗏𝗏 case was there, right? Okay, so where after the rape they cut her tongue, right? Now, so like at that time she wanted to give some declaration. Actually, what happened? So when a person is having very less time, but he wants to speak out the truth so that there should be justice. So at that time, you do not have enough time to bring out, to call the magistrate to record it. Anyone can record, even a doctor, even the village head, even the police, even the police can record in front of the two witnesses. That is dying declaration. During dying declaration, no oath is taken. No oath is taken. Leading questions are not allowed. Leading questions are not allowed. In India, we are practicing dying declaration. But what about dying deposition? Dying deposition is being practiced in the Western countries, where if a person got to know that within 7 to 10 days, he may die. Maybe suppose if a case of multiple myeloma, doctor said that you have only 7 to 10 days. Now he wants to declare his property. Now he wants to divide his property. Now he's going to invite one magistrate. Okay, the magistrate. So now dying deposition will be recorded only by magistrate. So here oath will be taken and leading questions can be asked. So during dying deposition, leading questions can be asked for sure. Fine now? In India, we are practicing dying declaration. So now out of these 4, leading questions are not permitted in direct examination, right? Direct examination. Direct examination. And easy to understand, no? Fine. A surgeon is operating on liver laceration case. A patient dies intraoperatively, the person who assaulted will be responsible for this. But if doctor has done some negligence during surgery, like forgetting any swab or instrument in abdomen during the surgery, and if patient dies, now then the responsibility may pass from original incident to later negligent act of the surgeon. Why all of you are wrong here? Res ipsa loquitur. First of all, please understand here that out of this clinical condition, in the beginning, when a surgeon is going to operate, okay, if he left any instrument or anything, okay, res ipsa loquitur, things speak for itself. But in this condition, in the beginning, if you are going to operate a patient of liver laceration, patient dies on the table, no problem at all. But if you forgot one swab or one instrument, now new action intervened in between. New action intervened in between. New action came in between. Now, doctor is also responsible. This is called as new novus action intervened in between. Novus actus interveniens. Novus actus interveniens, right? Next. A 25-year-old woman died in unnatural condition within 4 years of marriage. Her parents complained of frequent demand of money from her in-laws. Her autopsy will be performed. Most of you are right, Dr. Abdul Karim, you are correct. Most of you are. So most of you are thinking this is the case of dowry death, and I'm asking you dowry death. है ना? तो dowry death के हिसाब से तो भाई चलो ठीक है, A will be right answer. But this is not the question. No, I'm asking you, her autopsy will be performed under which section? Means inquiry will be done under which condition? CRPC 174 or 176. Inquiry will be done under magistrate. Answer will be D only. D. CRPC 174 police inquest. CRPC 176 magistrate inquest. Easy to understand? This was the question in AIMS. In this manner, easily you can slip. Yeah. That's why you do mistake in real exam, no? So you have to be very much careful. Now the question is that in which condition there will be magistrate inquest? Magistrate inquest. A, B, C, D, E. If there will be death in asylum, if there will be death in asylum, like psychiatric asylum hospital. Okay, if there will be Bostal death, Bostal matlab kya hota hai? Juvenile jail. C stands for the if there will be custodial death, dowry death, and E for exhumation. Exhumation means what? Digging out the dead body. So there are two types of magistrate inquiry. One is called as judicial magistrate. Another is called as executive magistrate. More powerful is judicial magistrate because these are appointed by the President of India. Executive magistrates are appointed by the high courts and all, right? By the state, right? So see here, judicial magistrate can handle all the cases, but executive magistrate only dowry and exhumation, only D and E, executive magistrate. Remember CRPC 174 and CRPC 176. Police inquest, CRPC 174. Magistrate inquest, 176. Okay, chalo, fine. It won't be considered as an offense when it will be done by a person who at the time of doing it, by the reason of unsoundedness of mind, is incapable of knowing the nature of the act, or that he is doing what is either wrong or contrary to the law. This is called as McNaughton's rule. Basically, if a person is insane or he does not understand the consequences of a the consequences of his act, he will not be punishable. Fine, he will not be punished. This is McNaughton's rule. Which IPC? IPC number? IPC number 84. Dr. Gokul, it is not 86, it is 84. 84. McNaughton's rule, extremely important. A doctor gets referral money from the labs for sending the patient for unnecessary investigation. Last time this question was there in December. No, that was related to radiological investigation. Fine. So fee space. So basically this is what? Fee splitting. No, fee splitting. Fee splitting means what? Dichotomy. Dichotomy. Okay, which is considered as one of the infamous conduct, right? No, infamous conducts. Dichotomy, infamous conduct. Fee splitting, writing unnecessary investigations and you are getting extra money. It is called a what? Dichotomy. Dichotomy. First of all, you'll be getting warning notice. First of all, you'll be getting what? Warning notice. Who will give you warning notice? Central Medical Council or a State Medical Council? Dr. Pandri is asking, admit card out, sir. Admit card aa gaya sabka? Okay, chalo, congratulations. All the best. है ना? What to do? है ना? Be. ठीक है ना? नहीं, doctor. Are you asking or you Dr. Pandiri? अच्छा, this is a prank. चलो कोई बात नहीं, जब भी आएगा. Okay, so whenever you are going to get, you will get it for sure. Don't worry. Okay, don't worry. You will get it for sure. So now you tell me, who will give you warning notice first? Central Medical Council or State Medical Council? First of all, State Medical Council. State Medical Council. Okay, now first of all, warning notice, and after that, there can be, if there will be serious medical negligence case, no? So there can be what? 100% what? There will be the professional death. And there will be what? Yeah, there will be professional death. Right now, that is called the penal erasure. Penal erasure. Or there will be what? Professional death. Professional death. Okay. Chalo, fine. Okay, now you tell me, a doctor who performed the autopsy on a 25-year-old married woman committing suicide found the cause of death to be aluminum phosphide poisoning. He was summoned in a court of law where he willingly hides the information. This is punishable under which section? So basically, what is? Very good. So basically, this is the case of what? Willful lying in court even after taking oath. This is called as what? This is called as the perjury. Definition is given by 191. Punishment is given by 193. And suppose if a person who is going to fabricate false evidence, no, fabricating false evidence, that will be what? 192. 191, definition. 193, punishment. 192, fabricating false evidences, right? So here answer will be what? D. Question 48. A 21-year-old male presented to emergency department with altered sensorium. NCCT revealed hydrocephalus, which requires urgent surgical intervention. The patient had nobody accompanying or any identity proof. Under which of these sections of IPC can the neurosurgeon perform the procedure without obtaining an informed consent from the guardian? Fine now. So in emergency condition, no need of taking the consent. This is given by IPC number 92. 90. All these IPCs you have to memorize. See, like some important IPCs, I will tell you in the last. Okay, so that will be fine. Fine now. So overall, see here, section 88 is important and 92 is important. See, like IPC 88, like whenever you are going to operate a patient with the good will, with the good intention, after that, if you are committing, like suppose after that, if you are losing the patient, your surgeon is not, he's not responsible for that, for the death, right now. Fine here. Section 92. See, section 92, emergency situation will be there. Consent is not required. You can operate the case. Okay, see here, like some important IPCs, please write separately. Please write separately. From where you can anticipate one question. IPC number 197 and IPC number 198. IPC number 197, 198. Issuing false certificate. Issuing false certificate and using false certificates. Doctor and patient both will be in jail for 7 years. Issuing false certificate is a punishable offense as per IPC 197. Using false certificate 198. Okay, fine. IPC number 269 and 270. 269 and 270. IPC number 269 and 270. See here, negligent act. Likely to spread the disease is a punishable offense. Okay, spread the disease, which is actually what? Dangerous to life. Suppose if a doctor who used a needle, same needle which he used in HIV positive, he forgot and he used the same needle in different person also. IPC 269. Negligent act. Okay, now next is willful act. Willful act likely to spread the disease, which is dangerous to life. You have, see, in the beginning during the pandemic time, you got COVID-19 positive. Willfully, you are going to a public place, you are meeting everyone, you are hugging everyone, you are going to sneeze in front of everyone, you are going to cough in front of everyone because you want to spread the disease willfully. This is a punishable offense. 270. Okay, fine. Next, see here, IPC 326A and IPC 326B. 326A. There will be punishment for 𝗲𝗏𝗃. 𝗲𝗏𝗃 means what? Acid throwing on the face. 𝗲𝗏𝗃, lifetime jail or minimum for the 10 years. IPC number 326B, attempt to 𝗲𝗏𝗃, right? Attempt to 𝗲𝗏𝗃. Okay, chalo, fine. Now next is related to rape victims. Related to rape victim. Related to rape victim. IPC number 166B and IPC number 228A. Even if you are working in a private hospital and if there is a rape victim, if you refuse the treatment, you will be punished at least for 1 year. Means if you do not treat the patient, if you do not treat a rape victim, 166B, 1 year in jail. Revealing the identity of a rape victim is a punishable offense by the media or by anyone. Fine now? At least for 2 years in jail. IPC number 228A. Okay, no? Okay, वो क्या था बताओ? Related to rape कौन सा था? Related to rape. Related to rape. Which IPCs? Yes, IPC related to rape, IPC number 375 and IPC number 376. IPC 375 definition, IPC 376 punishment for the rape. Fine. Okay, now related to dowry death. Related to dowry death. One is IPC number 304B. 498A. This is for dowry death. Dowry death. Minimum for 10 years in jail. IPC number 498A. 498A. Torture of a married woman by husband or in-laws. 498A. Fine. Okay. अच्छा वो क्या था? IPC number 354 ABCD. IPC number 354 ABCD. There will be punishment for sexual assault. Sexual assault. IPC number 354B. Using your power to disrobe a female. IPC number 354C, voyeurism, right? Voyeurism or scotophilia, peeping Tom. IPC number 354D, stalking. These are some of the important acts which you have to remember. Now, question is, ये बताओ ये कौन सा था? IPC number 509. IPC number 509. Any word or gesture which is intended to insult the modesty of a woman. This is considered as a punishable offense. Punishable offense. अच्छा वो क्या था ये बताओ? CRPC 416. What was that? CRPC 416. If a female who is found to be actually the pregnant, she was given death sentence. After death sentence, if she was found to be pregnant, yes, death sentence can be modified to either lifetime jail or like there will be postponement of what? Like the death sentence. Fine. Chalo. These are important IPCs. Next, what about this one? A married female is hit by her husband. Injury is shown in the picture. Her husband is booked under IPC number 324. As per the offense, husband should be punished for how many years? So basically, this is related to heart. Related to heart. Say here, IPC number 30, IPC number 300 and the 302. This is related to definition of murder, and IPC 302 this is for the punishment of murder. Remember, IPC is related to heart. When I talk about IPC number 319 and IPC number 320, IPC number 320 is grievous hurt. Grievous hurt means what? Serious hurt, severe hurt, which can lead to what? Like there will be a risk of life also. Grievous hurt. Suppose like after the fight, if there was what dislocation of tooth or fracture of bone, or maybe deafness or blindness or emasculation. When these are what? Grievous hurt, very, very serious. IPC number 319, only definition of hurt. Now, please remember IPC number 323, 324, first of all. Punishment for voluntarily causing hurt, 1 year. IPC number 324, voluntarily causing hurt with dangerous weapon. See, this is not a grievous hurt, but dangerous weapon is used here. No, in this question, dangerous weapon is used. Voluntarily causing hurt by a dangerous weapon. How many years in jail? Up to 3 years in jail. 3 years in jail, right? Answer will be B. Next, see here, IPC number 325 and 326. 325, voluntarily causing grievous hurt, 7 years. Voluntarily causing grievous hurt by dangerous weapon, now 10 years in jail. Fine. So please remember all these points, very, very important. Okay, remember one more IPC, that is called IPC number 304A. Death caused by rash or negligent act. See, remember IPC number 304A and B. A and B. IPC number 304A and B. A for apparent means medical negligent act. B for the bride dowry death. Okay. Chalo, fine. Next, last question here. Sexual satisfaction is obtained by rubbing against the person in the crowd. Please understand that in psychiatry or forensic, anywhere, sexual, all the paraphilias like sadism, masochism, lust murder, frotteurism, fetishism, eonism, dual role, and the trans, everything I've given you, right? All these things I have taught you. I know these are extremely important. One question every time you can anticipate. So rubbing against the person for sexual pleasure is what? Frotteurism. Frotteurism. Fetishism, using inanimate objects for sexual gratification. Eonism, which is also called the transvestism. Fine. So in this manner, we have completed the test and discussion of forensic also. And I hope like most of the points we have revised. Okay, now most of the points we have revised. Fine. So thank you so much. I wish you all the best. Good luck. I hope that most of you are going to pass this time. Now you are having only limited days. Please use your limited days, right? Wisely. Don't get frustrated. Don't get frustrated. And right now, use your time wisely. I will say only this much. Yeah, thank you so much. I'm glad. How to make a schedule for the 20 days you are asking? Yeah, dekho, I would suggest only one thing. See, Dr. Shubham is asking to arrange a fast track revision for forensic. I think you do not have any empty days in between. You do not have any empty days. I think so. Fine, no, but I would suggest you one thing. See here now. See here, even if you are losing your like self-confidence now, even if you are losing your confidence now, fine, no, I would suggest you please understand here that, see, you are having 19 subjects now, like you learn in this manner: anat, physio, micro, patho, biochem, and pharma, right? Okay. After that, you are having what? Internal medicine, surgery, obs gynae, PSM, optha. And then you are having what? ENT and the pediatrics. Last, you are having what? Psychiatry, radio, ऑर्थो, एनेस्थीसिया, फॉरेंसिक एंड स्किन. ठीक है, अब ये बताओ, चलो मुझे ये बताओ, आउट ऑफ दीज 6 नॉन क्लिनिकल सब्जेक्ट्स 90 क्वेश्चंस आर बीइंग आस्क्ड. ठीक है, 90 क्वेश्चंस आते हैं यहां से. ठीक है, एनाटॉमी 17, फिजियो 17 एंड द बायोकेमिस्ट्री 17. ठीक है, माइक्रोपैथोफार्मा 13. आउट ऑफ ये देखो, ये 5 मेजर सब्जेक्ट्स है ना, 30 एंड द 20, 140. 6 small subjects, number of questions will be approximately 45 or 45 or 50 होंगे यहाँ पर ना, 40 होंगे, right? This will be 40 around, right? 40. ENT pediatrics आएंगे 15. This will be approximately 30. I'm asking you, ये बताओ, you have learned a lot. For last 5 months or more than 1 semester, you have been learning. अच्छे से कर रहे हो ना सब. You have also learned in medical college also. Now I'm asking you, out of 90, are you able to score 50 marks? ये बता 50 लाओगे नहीं. If exam will be tomorrow, are you able to score 50 out of 90? आएगा नहीं आएगा भाई? आज easily you can score, no? Out of 140, I'm asking you to score only 80 marks, only 80. Out of 40, I'm asking you to score only 20 marks. अब ये बताओ, 50 plus 80, 130 plus 20, 150 तो ऐसे ही हो गया भाई. 150 ओवर. ये जो 30 मार्क्स है ना, बोनस. बोलो पास हो रहे नहीं हो रहा? If you see in this manner, I'm telling you, you can easily pass. Maintain the patience. Maintain patience, I'm telling you. ठीक है? You still have more than 20 days and easily you can pass. ठीक है? So in this manner, if you assess yourself, like you can easily pass. Fine. Rapid revision से? Yes. So many questions. See, I'm telling you one thing. Now, अभी जो चल रहा ना पूरा जो test and discussion is very, very important. Because all faculties are giving you only most important questions. No, most important topics are being discussed every time. Please remember that every time 70 to 80% topics will be similar. Every time there will be one question from HIV, TB, है ना? TB से रहेगा पूरा. जो भी है तुम्हारा, जैसे every time there will be what? Colles fracture and all. Every time one question will be there from glycogen storage disease, lysosomal storage disease. Every time one question will be there from schizophrenia, personality disorder and all. So 70 to 80% topics will be similar. I'm telling you, if you are thinking that you want to score approximately 300, impossible. नहीं होगा. 50 questions will be extremely difficult. I'm telling you, 50 questions will be extremely difficult. So most of you, all of you are preparing only for 250 questions. 250 questions will be there. See, 50 questions will be difficult for everyone. And please understand, देखो ये level of question क्या होता है? Level of question समझो. How they frame questions. See, 170 questions will be easy. Easy question 170. See, approximately 80 questions will be moderate. 80 questions will be moderate. and 50 questions will be very difficult. Very difficult. Yeah, this is the pattern of question which every examiner will follow when they frame the question. Because if you are able to score approximately 299 or 100%, tab to hai na, this will be question mark on the, you know, like on the examiner who has framed the question, right? No, so 50 question will be difficult for everyone. You have to target this one. You don't fail because you do not know the difficult topics. You fail because you do mistake in 170 easy questions. ये होता है पैटर्न, ये होता है पैटर्न, ठीक है? You should solve old question just for the orientation, but in the last moment, most important is the revision of most important topics. How much I have taught you in psychiatry and forensic. So like this time I'm expecting like these are the most important, and you have to revise all these like with your heart. Okay, no? So in this manner, this will support you a lot. Fine. Sir, how important is dua? You are saying the prayer, right? So do you think like this is going to help you like in getting good score? हाँ यार कहते खुदा मेहरबान तो गधा पहलवान. No, but no, see, like there should always be blessings, I would say. See, like the see here, 99%, I would say 99% there is actually perspiration. Only 1%, I would say these things are going to help you. But yes, like there should be everything, right? No, there should be everything, right? No, there should be everything. First, but 99% your hard work. But yes, 1%, yes, like if you believe, like if you believe, or there should be the blessings of elders. Yes, okay, fine. But these are just the supportive. I would say just the supportive. I would say that God helps those who help themselves. So overall, the conclusion, moral of the story is most important is hard work. But yes, on the day of exam, like you should pray, you should have the blessings of your elders. And after that, like you should be more, you know, like that day, most important thing will be your mental health. Mental health. Dr. Vignesh is writing elder like Khalil sir, huh? Okay, Dr. Muhammad Khalil, you are saying ki for the rapid revision, let's say because you do not have time, we can conduct, but you do not have any free days. No, last time, see, please understand that last time, how many, all of you who have scored more than 135 or more than 140, some students have scored 145, 148, 149, for sure you are going to pass this time. But please understand that, please understand that whenever you are going to enter into the examination hall, no, maintain the same energy from question number 1 to question number last. Dr. Sharvina, 149, no issues at all. Okay, I would say no issues at all. This time you are going to pass for sure. See, understand, maintain same energy level from question number 1 to last. Most of the people, so for this, most important thing, one day before exam, minimum 6 hours of sleep. 6 hours of sleep is mandatory, I'm saying. 6 hours of sleep. That day, if you will be mentally healthy, mentally fit, well composed, you can play like Mahendra Singh Dhoni. Or if you can lose the wicket like any hitter, I will not take the name of anyone, but yes. If you do not sleep on the day of exam, this will be the worst thing which you will do. Please understand, most important thing will be, deciding factor will be your emotion, your mood, your sleep. Everything will be dependent on your sleep and your diet. If you sleep well on the day of exam, hai na, raat mein, fine, best thing you will do. Stay happy, stay cool. रात को नींद नहीं आती आपको, तो you have to take medicine, or maybe you have to take maybe you have to do, you know, like some physical exercises, yoga, whatever. Okay, no issues at all. Like if you have some kind of anxiety issues and all, you can contact me personally. All right, sir, which medicine can I take to sleep, sir? Okay, you contact me personally, and this will be live on YouTube also. Yeah, alprazolam is good, but like without prescription, you should not take. Yes, Dr. Ram Kumar. Yes, okay, God bless you. Thank you so much. Question number 42. I think everything has given you. Like I will see that, Dr. Priya, no? Display again you are asking. Chalo, theek hai, I will see that. Okay, so chalo then, all the best. Fine. I wish to celebrate with all of you after 4th June. Okay. Chalo then, take care. Bye-bye. Good night. Thank you so much. Sure. I would love to take selfie with all of you. Thank you so much. Yes. Always. I will pray for all of you. Dr. Vasant, you asked me personally. Okay, no? Dr. Shubham, yes, आपका इंटरव्यू लूंगा पक्का. ठीक है, जितने भी लोग, सब लोग स्कोर अच्छा करो, सबका इंटरव्यू लूंगा मैं. ठीक है, पक्का. ओके, चलो फाइन. यस, you are asking question number 42, Dr. Tulsi, huh? Question number 42, leading questions are not allowed in, not permitted in. Okay, that will be direct examination, all right? So that will be direct examination, right? We have learned it, no? And that will be direct examination. Fine. Yeah, okay, Dr. Ashwin, yes, I will provide annotated notes also, and that PDF will also be circulated. Okay. Chalo then. Okay, fine. See you next time. Bye-bye. Thank you so much.